I would like to give the floor to the chairperson of the Committee on Credentials, Dr. Eric Nsiaboteng of the delegation of Ghana. Over to you, sir.
Good morning, ladies and gentlemen, and good morning, Honorable Chair for the Regional Committee. I'm here this morning to present to you the report of the Committee on Credentials, all protocols observed. In my capacity of a member of the delegation of Ghana, and as elected Chair of the Committee on Credentials, I have the honor to report on the work of the Committee on Credentials to the Regional Committee. The Regional Committee appointed representatives of the following 7 countries as members of the Committee on Credentials: Comoros, Congo, the Gambia, Ghana, Eritrea, Madagascar, and Rwanda. The Committee on Credentials met on 28 August 2023, and elected me, Eric Nsiaboteng, from the delegation of Ghana as its chairperson. Comoros, Congo, the Gambia, Ghana, Eritrea, Mauritius, and Rwanda attended the meeting of the committee. The Secretariat reported on the credentials received from the member states attending the Regional Committee and its efforts to facilitate the registration and submission of credentials. The committee mandated me as its chairperson to report to the Regional Committee on its behalf on the credentials submitted to the Secretariat as of the meeting of the Credentials Committee, and to consider and report to the Regional Committee on its behalf should any additional credentials matters require attention. At the time of the meeting of the Credentials Committee, 45 member states of the Regional Committee for Africa had submitted credentials which were found to be in conformity with applicable rules and practices of this hybrid session of the Regional Committee. Regarding the credentials received from Niger, the committee decided to recommend to the Regional Committee that it defers a decision on the question of the representation of Niger, pending guidance from the United Nations General Assembly. I thank you, Mr. Chairman.
Merci pour ce rapport de la...
Thank you for this report from the Committee on Credentials. Are there any comments on the report as submitted by the Committee on Credentials? Well, if there are no comments, I would like to suggest that we recognize the validity of the credentials presented by the member states as suggested by the report that has been presented to us. Once again, are there any comments? I don't see any comments. So we take note of the report on the Committee on Credentials. Thank you.
Nous passons maintenant au point 10.
I would like us to proceed to agenda item 10, titled Regional Strategy to Accelerate the Implementation of National Plans for Combating Antimicrobial Resistance 2023-2030 in the WHO-Africa region. This is under Pillar 1. Please kindly refer to document AFR/RC73/6 and the resolution referring thereto that is contained in document AFR/RC73/WE1. This document will be presented by Dr. Lindewe, Makobalos, Regional Sub-Director. Dr. Makobalo, you have the floor. You have 5 minutes for your presentation.
Distinguished delegates, colleagues. Good morning, and as the chair said, we will be presenting the item on the regional strategy for expediting and implementing the monitoring of national action plans on AMR 2023 to 2030. This is in document AFR/RC73/6. So please, for your reference. As I've said, in this agenda item, we'll be presenting this strategy as a mechanism, a way to assist us address the high burden of antimicrobial resistance that we are all faced with. So on behalf of the Secretariat, I'm pleased to take, I understand I have 5 minutes to do this. Antimicrobial resistance is one of the top 10 global public health threats currently, and the region is experiencing high levels of morbidity and mortality as a result of AMR-related conditions. 4.9 million people worldwide die of AMR-related diseases, of which 1.2 million were directly attributable to bacterial resistance in sub-Saharan Africa. 10 million people, including 4.1 from the region, are expected, unfortunately, to die because of AMR organisms by 2050. And countries across Africa could lose up to 50% of the GDP. So with the AMR challenge, it's really a challenge of the AMR, but also has a great impact on our GDP and development. In the region, wide gaps exist in optimizing antimicrobial resistance, and part of the reason why we're presenting this strategy is to find ways of optimizing these. The fifth GLASS report showed that for bloodstream infections, third-generation resistance in Escherichia coli and methicillin resistance were high in some reported member states. So what we will do in terms of this strategy is find ways of addressing these challenges. Now, maybe it's important to say that we do have AMR plans in many countries, although not most. And what we have found is that there's need for us to strengthen the plans because in many instances, for instance, the plans have not addressed some areas of the overall strategy on AMR, such as, for instance, bringing in the importance and emphasizing the importance of the One Health strategy. So in general, the purpose of national health action plans is to improve the understanding and awareness to AMR. Secondly, to strengthen evidence and the evidence based through surveillance and research. Thirdly, to optimize the use of antimicrobials both in humans and in animals. As we've said, the AMR is a huge problem actually, both in human health and in animal health. We also seek to increase investments in diagnostics, in medicines, vaccines, and so on. So the specific objectives of this particular, I think we have them being shown. Yeah, the specific objectives of this strategy, and I won't go into lots of details, is to strengthen coordination and governance to address AMR threats in human, animal, and environmental health at national and subnational levels through multi-sectoral approaches and all that we can do in countries to address and improve the implementation of our national plans, to improve awareness and understanding of AMR through effective communication, education, and so on, to enhance knowledge and evidence of AMR rates, and to optimize antimicrobials through humans. And this is very much, these objectives are very much aligned to the overall objective of National Health Action Plan. What we would like to emphasize here is the slightly weak One Health governance. I think that's my time up. But maybe just to say that our governance of One Health in countries really needs to be strengthened. And so as we present this strategy, what we would really request countries is that we really see how we can strengthen it. I think increasingly we are seeing the importance, need to increase resources, increase commitments for AMR, improve coordination, improve surveillance, as I've said, rational use of microbials. I have very limited time, but just to say in introducing this point that we thank you for, for the work that is being done, and we are presenting in this regional committee a resolution which is attached there for your reference. And basically the resolution is speaking to upping and basically strengthening the work that is currently being done around antimicrobial resistance and how we can deal with this threat, which, as we've said, is currently a threat which is affecting, development as well as our national development, as well as provision of services and so on and so forth. So with this, Chair, I have to stop because I had so much more to say. Thank you very much.
Merci, Docteur.
Thank you, Dr. Marco Balo. Distinguished delegates, I now open the floor for your comments and inputs. I remind you that you have 3 minutes for your comments. We will receive comments first from member states. Comments and inputs first by member states.
Levez vos...
Please kindly raise your flag so we can identify those who want to take the floor.
Le Togo a la parole.
Togo, you have the floor.
Le Togo.
Togo, over to you. Thank you, Mr. Chairman. Mr. Chairman, Madam Regional Director, Togo thanks Secretariat for the quality of the technical documents that we have been presented with in the context of implementation of the regional strategy for combating antimicrobial resistance in the African region and in line with the international health regulations. Togo has carried out interventions in the area of antimicrobial resistance. In that regard, the key actions related thereto are the preparation and implementation of a budgeted national action plan for combating antimicrobial resistance for the period 2019-2023. And this document will be revised by end of 2023. Identification of a national reference laboratory for surveillance of antimicrobial resistance, appointment of sector focal point for antimicrobial resistance, and the listing of Togo in GLAS 2020. Moreover, with the support of partners, outreach activities on antimicrobial resistance, prevention and control of infection, point-in-time actions on the prescription of antibiotics on hospitalized patients, activities pertaining to capacity development in bacteriological laboratories, assessment of organization capacities of microbiology laboratories in human and animal health were conducted. Collection of data on antimicrobial resistance surveillance were already carried out. However, our country is faced with multiple challenges in implementing this strategy, notably with regard to governance, mobilization of resources for capacity development and microbial diagnosis, research and innovation activities for collection of data in microbial resistance surveillance, antimicrobial, quality of antimicrobial medicines, and the issue of mainstreaming antimicrobial resistance in secondary, primary, and high school curricula. Also, we have the issue with regard to sharing and disseminating of research data. However, Togo deems relevant the actions that have been proposed for the next steps by member states and stakeholders in order to consolidate achievements and address future and persisting challenges. Togo therefore duly takes note of this report. Thank you, Mr. Chairman. Thank you, Togo. Now we would like to give the floor to the delegate from Congo. Thank you, Mr. Chairman. I would like to commend the chair for the manner they are conducting the discussions. I would like to commend the quality of the report that was presented by the Secretariat. This document dwells on a strategy, a regional strategy with regard to national action plans in combating antimicrobial resistance 2023-2030 in the African region. Microbial resistance is a challenge to global health. It may become the next pandemic that will affect all various types of infectious agents and that will leave us without any efficient means of control. Faced with this challenge, it is essential that experts from different sectors should come together and work. In 2021, within the context of One Health, the Republic of Congo adopted a national strategy 2022-2026 for combating antimicrobial resistance. And this strategy aims to foster surveillance, regulation, sensitization, and research on antimicrobial resistance in the areas of human, animal, and environmental health. Several actions were taken or are being continued, notably sensitization among the populations and health workers on best practices and usage, the regular updating of the list of germs resistant to antimicrobial drugs, and clear rules applicable in health, animal, and environmental health. Congo suggests, therefore, that this report be adopted. Thank you. Thank you, Congo. We would like to give the floor now to the delegate from Nigeria. Rwanda, please be ready to follow after Nigeria.
Endorses the regional strategy for expediting the implementation and monitoring of national action plans on antimicrobial resistance in the WHO African region. This comprehensive strategy is a vital step towards addressing the critical issue of AMR, which poses a grave threat to human, animal, and environmental health in our region. We acknowledge the collective effort that has led to the development of this strategy, recognizing the urgent need for a coordinated approach to tackle the challenges of AMR. As a nation, we are committed to this cause and have taken significant strides in combating AMR. Our operational national One Health AMR governance structure reflects our commitment to a multi-sectoral approach, and our first national action plan, spanning 2017 to 2022, demonstrated our dedication to action. We are actively working on our second national action plan, which incorporates a robust monitoring and evaluation framework. We acknowledge the intricate connection between antimicrobial use in animals and its potential repercussions on human health. And as a part of our comprehensive strategy to counter AMR, we have taken significant steps, including the prohibition of antibiotics as growth promoters and mold inhibitors in animal feed. We are also actively considering a stringent measure to ensure the sale of veterinary antibiotics solely under prescription, underscoring our commitment to responsible antimicrobial use and the reduction of AMR. These actions align with the objectives of the regional strategy. While progress has been made, we must recognize the persistent barriers hindering the effective implementation of national action plans. Inadequate investment, human resource capacity, and weak linkages between key national strategies have impeded our efforts. The 2022 quadripartite Tracking AMR Country Self-Assessment Survey highlighted the crucial role of One Health governance and coordination platforms, which need strengthening for effective implementation. Nigeria echoes the need for integrated multi-sectoral approaches to drive the implementation of our national action plans. We fully support the prioritization of multi-sectoral coordination, awareness and education, evidence-based surveillance, responsible antimicrobial use, and sustainable investments. Finally, we are deeply concerned about the influx of fake and substandard antimicrobials through illicit channels. We believe as Nigerians that partnership and collaboration among member states are crucial to addressing this issue effectively. Thank you for your kind attention.
Merci.
Thank you. Rwanda, you have the floor. Namibia, be ready after Rwanda.
Regional strategy for expediting the implementation of national plan on AMR in the WHO-AFRO region. AMR is indeed a major threat to human, animal, and environmental health, which require appropriate multi-sectoral approach. Rwanda takes this issue seriously and is already implementing AMR surveillance and the enforcement of AMR stewardship-related activities. We have already a One Health policy with One Health AMR governance mechanism, which includes defined role and responsibility across sectors and established accountability arrangements, One Health strategic plan, a national plan on AMR, which is being revised to be aligned to the time frame of the regional strategy. We have quite a number of achievements, but we know there is a lot to do. And I wish on behalf of my delegation to support the adoption of the proposed strategy. Thank you.
Merci.
Thank you. Namibia, over to you. Ethiopia, get ready after Namibia.
Floor. Namibia would also like to congratulate the Secretariat for a good report and its commitment. We take note the situation analysis and justification that inform the development of the AMR strategy. This shows great commitment. Considering the uncontrolled antimicrobial overuse and misuse in humans, plants, and animals across the region, and the risk posed by substandard and falsified medicines, the strategy serves as an accelerator of the implementation of national action plans on AMR and a reminder to prioritize AMR in our health systems. In Namibia, we have upgraded our standard treatment guidelines and have also revised our essential medicine list. Namibia has also incorporated a multidisciplinary antimicrobial approach aimed at establishing an effective AMR response system, which is pharmacist-led approach that enforces rational prescribing of antimicrobial agents, educates other healthcare workers on the appropriate use, disposal, and storage, as well as counseling of patients on the current use of antimicrobial agents. However, our efforts are negatively impacted by the shortage of qualified healthcare workers, such as pharmacists, medical doctors, and nurses. With these remarks, we call on Secretariat to continue support to Member States to sustain the gains achieved in the implementation and monitoring of action plans on antimicrobial resistance. In closing, Namibia supports all priority interventions in the strategy, recognizing the prominence of raising awareness and education on AMR as the cornerstone to tackle AMR in our region. I thank you, Honorable Chairperson.
Merci.
Thank you. And I'll give the floor to the delegation from Ethiopia. Senegal, please get ready to go next.
Thank you, Mr. Chair. The government of Ethiopia commends the regional secretariats for highlighting antimicrobial resistance, which is currently posing a formidable threat to public health in Africa, potentially reversing hard-won gains in universal health coverage, health security, and sustainable development. Responding effectively to this challenge demands urgent collective action. It's to be recalled that in 2015, WHO member states adopted a global action plan on AMR and committed to developing national action plans. 45 out of 47 African countries now have enough, but progress in implementation has been slow. As a proactive leader, Ethiopia adopted its National Action Plan in 2015 alongside other African nations. National AMR stewardship and awareness raising on AMR and its adverse impacts have progressed. Education and behavior change campaigns have been implemented to promote appropriate antimicrobial use. Sentinel surveillance sites have been established for AMR monitoring and research, which generate data to inform AMR containment efforts have been done. Besides, sector-specific AMR work plans have been formulated by the Ministry of Health, Ministry of Agriculture, and Environment Protection Authority to define clear roles and responsibilities. The implementation of NAP has been constrained by supply gaps, inadequate financing, and partner support for comprehensive AMR efforts, suboptimal evidence generation, limited regional level capacity and buy-in for AMR prevention and containment, and limited enforcement of policies and guidelines related to antimicrobial prescription, dispensing, and use. Ethiopia remains steadfastly committed to strengthening the implementation of NAP through continued advocacy and a capacity building, multi-sectoral One Health approach. The government of Ethiopia aims to strengthen multi-sectoral coordination, improve awareness and education, enhance surveillance system and data, and optimize antimicrobial use in humans. To this end, the country strives to strengthen its AMR governance and monitoring system, conduct awareness campaigns, report surveillance data, and implement interventions to optimize antimicrobial use. Robust political commitment has already catalyzed concrete efforts and investments. Ethiopia welcomes continued partnership with WHO to reinforce capacities and align with stakeholders to reduce the effect of AMR. In conclusion, Ethiopia stands ready to leverage collective strengths in pursuing our common goal, preserving antimicrobials as life-saving medicines for future generations in Africa and beyond. I thank you.
Merci.
Thank you. Senegal, you have the floor. And Uganda, be ready to go next. Mr. Chairman, distinguished ministers, ladies and gentlemen, Regional Director of WHO for the African region, Ladies and gentlemen, distinguished delegates, thank you very much. All protocol observed. Following the World Health Assembly, which dealt with the drawing up national action plans to combat antimicrobial resistance in 2015, Senegal came up with its own multi-sectoral national action plan for combating antimicrobial resistance, which went up to 2022. This plan was in line with global guidelines on how to combat antimicrobial resistance, and the objective of this plan was for us to be much more effective using an integrated One Health approach. Given the increasing rise in resistance to antimicrobials in Senegal. In the context of the implementation of this plan, Senegal created a national committee to deal with antimicrobial resistance, which was looking at the rational use of antibiotics, and it was trying to have this comprehensive AMR approach. We came up with a technical plan, which also, and policy development is underway. In addition, laboratory capacity has been strengthened in all sectors at the qualitative level. And this relates to the sensitivity tests when we come to testing for AMR resistance. We also have specialized in our bacteriological examinations or analysis that we carry out. We have carried out a survey of AMR. We have looked at it in the context of settings, healthcare settings, and also we have looked at the area of health-associated infections. We have also come up with measures to limit the use of antimicrobials in livestock and raising other animals, as well as environmental mental health issues in order to diminish and mitigate this problem of resistance. A new plan has indeed been developed from 2023 to 2028. Senegal will spare no efforts in implementing this new national action plan in order to reduce this public health problem, which is AMR. We would like to subscribe to this new African strategy and push for its adoption. Thank you. Thank you very much. I now give the floor to Uganda. Guinea, please go next.
Chair, Excellencies, distinguished guests, Uganda welcomes the strategy and endorses it. Aware that no new antibiotics are coming up and resistance is rapidly spreading, antimicrobial resistance is now a threat at the same level as climate change and a threat to global health security. The misuse of antimicrobials and contamination in the environment has led to a potentially catastrophic rise in antibiotic resistance. The possibility of a post-antibiotic era looms large, threatening to draw the global community back and reverse the achievements and advances of modern medicine. Chair, use of same antibiotics in both animals and humans requires that regulation should be handled in a very stringent way and preferably through a One Health approach. In this regard, Uganda established a National Antimicrobial Resistance Committee that developed Antimicrobial Resistance Action Plan 2018 to 2023, handled by 3 ministries of Health, Water and Environment, Agriculture and Animal Industry, and Wildlife Authority. Building resilient systems to prevent and treat infections at large, and integrating in antimicrobial resistance initiatives in all national strategies for universal health coverage is extremely important, and countries should be assessed on this resilience and integration. We should not forget to prioritize research and development and funding in the new pipelines of innovative antimicrobial resistances for diseases that are still highly prevalent in our communities, notably malaria, TB, HIV/AIDS, and others. While drug-resistant bacterial infections threaten populations around the world, we should be aware that more people in low and middle-income countries die because of lack of access to antibiotics, as the recent report by the Center for Disease Dynamics and Economics and Policy highlights. This should not be forgotten as well. I thank you, Chair.
Merci.
Thank you. I give floor to the Republic of Guinea. Comoros will be next. Thank you, Chair. Guinea would like to congratulate the Secretariat for the excellent quality of the documents submitted for our consideration. For many years, we have made antimicrobial resistance and combating a priority. So in 2017, we had a plan for combating antimicrobial resistance. The objective was really to see how we can best combat this scourge. From 2018 to 2019, we began with implementing our plan, which was then amplified so that we could cover the period from 2020 to 2024, after we had a situation analysis done of antimicrobial resistance carried out at country level. We have also put forward many collaborative actions. Despite the situation analysis and despite the drafting a multi-sectoral plan, we have had some obstacles in terms of coordinating our efforts. So Guinea is not really in a position to be effectively combating antimicrobial reasons for many reasons, including the lack of human resources, inadequate financing, and also a lack of coordination. Guinea would like to seek the support of the Secretariat in order to face and overcome these challenges. Guinea would like to approve the priority interventions of the strategy for expediting the implementation of the strategy. Guinea would like to approve the strategy, and thank you for your kind attention.
Merci. La parole.
Thank you, and I give the floor to the delegate from the Comoros and Zambia. Be ready to be next. Thank you very much, Mr. Vice Chair. The Union of the Comoros would like to congratulate the Secretariat for the quality of this document. Mr. Chairman, we have noted that this strategic framework is very justified, and it is indeed appropriate for us to be able to deal with the problem of AMR in the African region. Mr. Chairman, AMR today is one of our greatest challenges facing our region. We're talking about a threat to public health here, as well as it's a kind of silent pandemic, and it really will affect our development as a whole. Mr. Chairman, the Union of the Comoros has carried out a situation analysis of antimicrobial resistance, and it has also come up with its national action plan, which is a multi-sectoral one, in order to combat the effects of antimicrobial resistance going up to 2026. We have for 2023 to 2027, we will be having some training programs which also take into account budgeting and other training exercises. And we also took part in a meeting which took place in June in Brazzaville. We have been working on the area of working at a multi-sectoral approach and trying to improve our quality. The problem of antimicrobial resistance is so very difficult that it could, in fact, impact on us on the Astana PHC approach. It will help us. It can be an obstacle to us to achieving our SDGs. It is therefore essential for us to get the means and resources in order to combat this scourge. We need to sensitize our communities and also make sure that they do not resort to substandard or falsified medication. So WHO, FAO, and other technical and financial partners need to work together to implement this strategy under the One Health approach. Mr. President Chair, please also be aware of the specific problems that face us as the SIDS, the small island developing states. We do need to have special support in this regard. If necessary, we do need to have means and ways of ensuring that we keep our health security. This is so as to achieve UHC and the SDGs. My country, therefore, would like to support the adoption of these of the strategic framework. And thank you for your attention. Thank you. I now give the floor to Zimbabwe and Eritrea. Please be ready to go next.
Thank you, Chair. Zimbabwe appreciates the great work done by the Secretariat on this regional strategy. Zimbabwe faces significant and ongoing resistance in common infections such as TB, malaria, HIV, and STIs. The government of Zimbabwe, with support from the Food and Agriculture Organization of the United Nations, the World Health Organization, and the World Organization for Animal Health, developed the first Zimbabwe One Health Antimicrobial National Action Plan 2017 to 2021, which was launched in 2017. The country is one of the member states with a functional multi-sectorial technical working group on antimicrobial resistance. The implementation of the National Action Plan is across the human and animal health, agriculture, and environmental sectors. A multi-sectorial coordinating committee was set up to oversee implementation of antimicrobial National Action Plan. Currently, the country is reviewing its strategy. Zimbabwe has realized a need for the country to strengthen the One Health approach as gaps in the plant sector still remain. Antimicrobial education and awareness to promote responsible antimicrobial use and build public support for antimicrobial initiatives needs to be reinforced in the country. An identified country need is promoting research and development of new antimicrobial agents and alternative therapies, whilst ensuring that existing antimicrobial medicines are used responsibly and in a targeted manner. Zimbabwe is moving towards closing the gaps in laboratory capacity across the human, animal, plant health, and this requires support from various agencies. Whilst Zimbabwe has been strengthening infection prevention and control IPC and water, sanitation and hygiene, wash in health facilities to address hospital-acquired infections like other African countries, we continue to struggle with the data on healthcare associated infections. In conclusion, Chair, Zimbabwe acknowledges the need to have a regional strategy to strengthen national governance, to prioritize antimicrobial agenda, national surveillance systems, education and awareness, appropriate antimicrobial use in patients and IPC and wash in health facilities in communities, and therefore is for the adoption of this strategy. I thank you.
Merci.
Thank you. Eritrea, you have the floor, and Kenya will be next.
Thank you, Mr. Chairman. I would like to comment the inclusiveness and quality of the document present. Eritrea has carried out interventions on AMR. A multi-sectorial coordination committee for AMR was established in 2017. It's led by the Minister of Health and co-led by the Minister of Agriculture. Intra-sectoral coordination committees were established in respective institutions. The team developed the National Action Plan 2017-2022 on AMR, which was approved by the ministers of all respective institutions. The national human and animal health laboratories can detect, isolate, and identify antimicrobial resistant organisms from humans and animals but conducting such activities is a challenge for food and the environment. Infection prevention and control at health facility level is guided by action plans developed at national level. In animal health, there is a national plan for preventing infectious disease in animals, systems that support implementation of good animal husbandry practice, biosecurity, and vaccine strategies are available. There are national plans for vaccination in terrestrial animals. Reporting system for animal disease to veterinary service is in place. Extension services to farmers and livestock owners are extended up subzonal levels. Regulations and policies in use of antimicrobials in human health are in place. A national medicine schedule for human health developed in 2019 instructs that all antimicrobials must be used only upon prescription from a qualified healthcare professional. Treatment guidelines and manuals for rational use of medicine are also available. At national level, there is a functional National Medicines and Therapeutics Committee established in 2012. The Ministry of Health has a mature system of market surveillance for detection, reporting, and investigation of substandard, falsified, counterfeit antimicrobials. About 90% of healthcare professionals are trained on how to detect and report standard and falsified medical products. Such a system is not in place in the animal health. One of the major achievements on AMR was raising awareness and sensitization. In a One Health approach, the Ministry of Health, Ministry of Agriculture, Ministry of Marine Resource, Ministry of Information, Ministry of Land, Water and the Environment, and UN partners have been conducting massive annual national antimicrobial awareness week campaigns since 2017. In these public campaigns, several hundreds of thousands of people were covered, and a reach and recall post-campaign assessments report showed that the impact of the campaigns was remarkable. So finally, we suggest the document be adopted. Thank you.
Merci. La parole au
Thank you. I now give the floor to Kenya. Angola will be next.
Thank you, Chairperson. Kenya congratulates the Secretariat for the development of the regional strategy for expediting the implementation and monitoring of national action plans on antimicrobial resistance. This strategy will be an indispensable tool in addressing AMR and aligns with Kenya's commitment to universal health coverage and national health security. Kenya acknowledges that multi-sectoral efforts are required to address AMR and has therefore developed a One Health National Action Plan for AMR prevention and containment. This One Health approach involves collaboration between the health, human health, animal health, environment, maritime sectors, and other stakeholders to curb antimicrobial resistance through the National Antimicrobial Stewardship Interagency Committee established in 2018. As part of our National Action Plan on MR, Kenya has a robust monitoring and evaluation framework and has been submitting MR surveillance data to the Global Antimicrobial Resistant and Use Surveillance System, GLAS, for the past 2 years. Kenya also has in place a National Infection Prevention and Control Program, facility antimicrobial stewardship programs, as well as a clear policy and action plan to implement measures to minimize the spread of infections in health facilities, to limit the development and spread of antimicrobial resistant infections. In closing, Kenya acknowledges that misuse of antibiotics, including self-medication, is a major driver of antimicrobial resistance and requests WHO to support the development of legal and regulatory frameworks to promote rational use of antimicrobials and to restrict over-the-counter sale of antibiotics. Further, we urge the WHO to support member states to develop culturally relevant education campaigns to raise awareness about AMR, the importance of appropriate antibiotic use, the potential consequences of misuse, as well as promote behavior change among communities to combat this threat. In conclusion, I wish to affirm Kenya's steadfast support for the fight against AMR and to register Kenya's endorsement of the proposed strategy. I thank you.
Merci. La parole.
Thank you very much, and I give the floor to the delegate from Angola. Mauritania, please be ready to go next. Thank you. In this session, we would also like to congratulate the Secretariat for introducing such an important agenda item, because this is indeed a public health concern and it merits our full attention. Angola has developed its National Action Plan on antimicrobial resistance in 2008 with the support of the World Health Organization when it was in a transitional phase. We have carried out various awareness-raising workshops, and we were trying to reach all the health professionals in this regard. We have been working at the central level, and we have been supported by the WHO. They are coordinating the carrying out of activities by our focal points, particularly in respect of infection prevention and control. We would like to support expanding this strategy, particularly in terms of monitoring and evaluating our AMR NAPs. Our plan goes from 2023 to 2030. We really would like to count on the continued support from the WHO in this regard. This strategy must be in line with quality control of our medicines available so that we can avoid the issue of substandard or falsified medicines, because this will help us to better identify and diagnose antimicrobial challenges, and it will help us to have a more efficient response to such problems. We also need to increase the health literacy of our population. They need to be better sensitized, especially in terms of prescribing dopes and also the national regulations in this regard. Angola would like to subscribe to and support this strategy. Thank you so much.
Merci. La parole est au délégué.
Thank you. I now give the floor to Mauritania. Benin, please be ready to go next. Mr. Chairman, Excellencies, ladies and gentlemen, Mauritania would like to join the other countries of the WHO African region to congratulate the Secretariat for the excellent quality of this document, which is called Regional Strategy for Expediting the Implementation and Monitoring of National Action Plans on Antimicrobial Resistance. Well, I don't want to belabor the point of the importance of this topic, but indeed, it is a very important issue at the national, regional, and global levels. In Mauritania, we have mobilized all these sectors involved under the context of One Health, and we have developed a strategy. We have a multi-sectoral committee that we set up in order to combat AMR. Here we have all the stakeholders who have come together at the national level, and so we have this national action plan to combat antimicrobial resistance. We have a national guidelines for monitoring and evaluating what is going on the ground. We also have an oversight committee. We have focal points which are set up at different levels of the health pyramid so that we can have a better surveillance of the area of AMR. And we also have our national essential medicines list, which is aimed at monitoring efficiently how antibiotics are used, prescribed, and delivered within the health system. We would therefore like to reiterate our availability and readiness to be here at the very highest of level so that we can really step up with implementing the strategy, this regional strategy. Thank you. Thank you very much. I now give the floor to Benin, and Tanzania will be next. Thank you very much, Mr. Chair, ladies and gentlemen. Benin would like to congratulate the WHO Secretariat for all the efforts that they have made in the region with regard to combating antimicrobial resistance. Benin is very happy with WHO's interest in this topic, because this is an area which is proving to be increasingly problematic in terms of public health, and it is a threat to our populations. Benin notes with satisfaction all the efforts that WHO have been deploying to stand by itself in combating us and other countries in terms of combating AMR. It's indeed very important for us to have this synergy. We have the tripartite partners, we have WHO, we have FAO, and we also have the UNEP and the World Animal Health Organization. So it's quadripartite. The government of Benin has really understood the challenges that face us in the area of AMR, and we have therefore subscribed to GLASP, and for some years we have been pitilessly fighting against this scourge. We have a program called Point GR9, and this is focused on the medicines that are being prescribed, including the antibiotics. Benin has really been working together with the pharmaceutical industry so that we could come up with an agency which would be monitoring and surveying the situation so that we can look to the area of the prescription of antimicrobials and antibiotics. We have also been working very hard on implementing sentinel surveillance sites so that, and we would really like to thank WHO for supporting Benin in this regard. In light of the above, Benin would like to fully support the implementation and the adoption of this regional strategy for expediting the implementation and monitoring of national action plans on antimicrobial resistance 2023 to 2030 in WHO African region. We would also like to call on WHO to help us, both in terms of technical and material support, so that we can really actualize all our national plans in terms of combating antimicrobial resistance. Thank you. Thank you very much. I now give the floor to Tanzania. Central African Republic, you will be next.
The Republic of Tanzania is implementing the second version of the National Action Plan on Antimicrobial Resistance and a One Health approach. And this first action plan laid the background framework for the second, which is being implemented between the year 2023 up to 2028. Furthermore, the ANP-AMR implementation activities are in conformity with the global and regional guidelines on AMR under 4 thematic areas, including awareness and education, AMR surveillance and laboratory capacity, infection prevention, control, water hygiene and sanitation, that is WASH, and optimizing the use of antimicrobial in humans and in animals. Chairperson, various guidelines, frameworks, laws, and regulations have been developed and reviewed to support the implementation of the ANP-AMR. The United Republic of Tanzania has enrolled in the GLAS. This is the Global Antimicrobial Resistance and Use Surveillance System. And through this, we are implementing with the Ministry of Health and the Ministry of Livestock and Fisheries. And out of this, we've been able to use the surveillance data to review the standard treatment guidelines, which were reviewed in the year 2021. Chairperson, despite all these initiatives to combat AMR, the trend is still very not promising, especially it is affecting predominantly the poor and children and is largely challenging our IPC measures. Access to culture and susceptibility are largely limited to tertiary and a few secondary hospitals. In addition, we've seen antibiotic residues from hospitals, pharmaceutical companies, and agriculture-contaminated water sources that also increase the risk of AMR. Untreated infections due to AMR in animals threaten sustainable food for population. Generally, while the rate of infection is increasing, there are limited innovates in the markets, which in turn increase their cost, since antimicrobial are the cornerstone of the healthcare system. There's a need for government, implementing partners, and other private sectors to coordinate efforts to address AMR and thus contribute to achievable global health security agenda, but also universal health coverage and sustainable development goals. The United Republic of Tanzania congratulates the Secretariat for coming up with a regional strategy for AMR that will guide the member states on the efforts to combat AMR and also to foster coordinated efforts. And in doing so, we adopt the strategy. Thank you, Chair.
Merci. La parole est...
Thank you. I pass the floor to Central African Republic. Malawi, be ready after Central African Republic. Thank you, Chair. Central African Republic commends the Regional Director and the Secretariat for making it possible for us to address this topic of the Regional Committee. Mr. Chair, antimicrobial resistance is a real public health problem. Fragile states facing problems with porous borders facilitate the circulation of counterfeit medicines with armed groups involved in their traffics, therefore exposing the country further. Greater attention, therefore, should be accorded to these states. Also, the weak capacity of the health system to carry out studies and produce data on the scope, magnitude of this situation should be taken into account. Data collected could be used to sensitize decision makers and raise further political and high-level commitment through large-scale actions in favor of populations and health workers. WHO's efforts to support countries in implementing specialized actions in antimicrobial resistance and in developing a model action plan with tools for the preparation and implementation of action plans at multi-sectoral levels through the One Health approach has been very much appreciated. Central African Republic urges WHO to foster their support. Central African Republic approves the priority interventions contained in this document. I thank you. Thank you. I would like to give the floor now to Malawi. Madagascar, prepare.
And monitoring of national action plans on antimicrobial resistance 2023 to 2030 in the WHO-AFRO region. Malawi first AMR strategy was drawn from our health sector strategic plan 2, where AMR was strategically integrated as a critical area of intervention from the year 2017. Most of the priority actions, strategic interventions, and activities in the NAP 2017 to 2022 were largely implemented at the national level and in the selected regional referral hospitals, as well as in the central and zonal veterinary centers. The thematic areas for the previously implemented NAP included education and awareness, surveillance and research, infection prevention and control, and optimal use and investment and sustainability. Some of the milestones include that Malawi has a functioning National Technical Working Group, which is chaired by the Secretary for Health. The Technical Working Group has defined terms of reference for oversight as well as coordination of AMR-related activities, programs, and technical expertise from diverse sectors. Malawi also has an AMR Coordinating Center, which houses staff that drive the NAP on AMR implementation in the context of One Health approach. The 5 subcommittees take full responsibility of implementing and monitoring different aspects of the action plan, which include education and awareness, surveillance, including laboratory strengthening, IPC hygiene and biosecurity, as well as rational use of antibiotics and research and development. And some of the key achievements are, in 2017, we developed the National Action Plan. In 2019, we enrolled in GLASS. In 2019, we also adopted the Animal Health Surveillance on AMR. In 2020, establishment of AMR National Data Warehouse. And also in 2022, integrating of AMR data into IDSR. Every year in November, Malawi, we participate in the World Antibiotic Awareness Week, which is set by WHO. And during this week, which is the activities held include radio activities, newspaper activities, as well as social media. Malawi at the moment is in the process of developing the NAP 2023 to 2030, and we are at 85% completion. Some of the strategic objectives of the new strategy include strengthening coordination, collaboration, and governance for NAP on AMR implementation, but also creating awareness and understanding of the antimicrobial resistance through effective information, education, and communication, but also strengthening the knowledge and evidence-based through surveillance and research. Malawi supports the adoption of AMR regional strategy. Thank you.
Merci. La parole.
Thank you. I pass the floor to Madagascar. Botswana, prepare. Thank you, Mr. Chairman. Excellencies, honorable delegates, distinguished delegates, Madagascar is honored to take the floor on agenda item 10. We thank Secretariat for the quality of the report. Government of Madagascar joins the efforts of the WHO African region to prioritize combating antimicrobial resistance. In fact, our region has a high morbidity and mortality rate due to antimicrobial resistance with socioeconomic and health consequences that are significant. Madagascar aligns itself with the regional strategy to fast-track the implementation and monitoring of national action plans on antimicrobial resistance for 2023-2030 period in WHO African region. We therefore support the priority interventions that were presented in the strategy. Madagascar has developed a national action plan on antimicrobial resistance in 2019. Our national action plan on the prevention and control of infections with its operational plans was validated this year. Lastly, the national pharmaceutical policy was updated and in the process of being validated. WHO has supported this process throughout. The plans are complementary and our government authorities have approved them. Madagascar is among the countries that are committed in the global antimicrobial resistance surveillance since July 2017. The implementation of our national action plan to combat antimicrobial resistance adopts the One Health approach with a multi-sector monitoring committee involving the human, veterinary, and environmental sectors. A four-party coalition of partners, including WHO as the lead, the the FAO of the United Nations, the United Nations Environmental Program, and the World Animal Health Organization is supporting our country. And broadly speaking, the financing of the implementation of this action plan to combat antimicrobial resistance falls within the overall context of the National Health Security Program. Its implementation requires the mobilization of more resources. Madagascar has examined the report and proposes that it be adopted by the regional committee. I thank you for your kind attention. Thank you. The floor now to Botswana. Seychelles, prepare.
Welcomes the report of the Secretariat and the proposed regional strategy for expediting the implementation and monitoring of national action plans on antimicrobial resistance 2023-2030 in the WHO Africa region. Chairperson, despite the high AMR attributable morbidity and mortality in the region and the daunting possibility of countries across Africa losing up to 5% of their GDP, as asserted by the Secretariat, Botswana nevertheless notes with appreciation the progress made by the member states in finding solutions to the challenges. This is evidenced by 45 member states that have developed national action plans on AMR, with 33 of those being endorsed by national authorities. Botswana is committed to being part of the regional AMR strategy, which aims to guide member states' efforts to curb AMR and continues to apply key interventions to enhance national action plans implementation in line with the One Health approach. And it is in that regard, therefore, that we have embarked on a multi-sectoral approach to combating the emergence of antimicrobial resistance, hence the establishment of a comprehensive national action plan to contain common bacterial infections, HIV/AIDS, malaria, and multi-drug resistant tuberculosis. So far, the national governance structure has been set up and technical working groups have been formed. Botswana's political commitment is evidenced by its pledge during the UN high-level meeting on AMR, where the world leaders made a political declaration to commit to working at national, regional, and global levels to develop and implement multi-sectoral NAPs, programs, and policy initiatives in line with the One Health approach and the GAP. In conclusion, Chairperson, Botswana supports the adoption of the proposed strategy and commits to its operationalization thereof. I thank you.
Merci.
Thank you. The floor now to Seychelles. Mali, prepare.
In the last 10 years, Seychelles has seen a proliferation of private pharmacies in our country. This, coupled with the belief in many of our citizens that antibiotics are a magic bullet for most of our ailments, and often health professionals overprescribing antibiotics, have resulted in overutilization of antibiotics. Antibiotics are sometimes even sold over the counter, much to the dismay of our health authorities. The percentage of microorganisms resistant to antibiotics in Seychelles keeps increasing year by year. Seychelles is therefore determined to address this issue head-on. Our country has a well-developed national program for infection prevention and control. It is in force since 2010. Achievements include the development of the National Strategic Framework 2021-2025 and National IPC Guidelines. An active group of dedicated IPC focal persons also provide advocacy on health-associated infections and other AMR-related monitoring activities. A multidisciplinary AMR task force was set up in 2017. However, its activities could not be sustained for various reasons and was superseded by an antimicrobial stewardship technical working group in June 2022 with a much narrower scope of work. We are now setting up a multidisciplinary AMR task force. Our National AMR Action Plan was initiated in 2018. It is being urgently revised to guide critical action in key areas by strengthening lab networks, increasing and improving surveillance, and developing appropriate databases. Our new medicine and pharmaceutical products law aims to target AMR head-on. We are also working hard on the country's One Health approach, by which animal health, human health, and environmental health professionals have come together to face the challenge. With this background, Seychelles supports the AMR Regional Strategy and Action Plan 2023-2030 and the accompanying resolution to address antimicrobial resistance in the WHO-AFRO region. I thank you.
Merci. La parole est...
Thank you. I give the floor to Mali. Lesotho, prepare. Thank you, Mr. Chairman. Honorable guests, Mali congratulates WHO Secretariat for the strategy and progress made in the area of combating antimicrobial resistance in the African region through the implementation of national action plans to combat antimicrobial resistance. In Mali, the government has initiated actions by putting in place a national platform, a multi-sectoral health platform known One Health 2018, a national multi-sector plan to combat antimicrobial resistance was prepared, and thematic groups are in the process of being formalized through the One Health platform. Several actions have already been carried out to implement the action plan, notably surveillance of antimicrobial use, prevalence surveys on the use of antimicrobial drugs in health facilities, the gradual putting in place of therapeutic committees and medicines committee, given that this has already started in some health facilities. The putting in place of a control and prevention plan for infections, and also the putting in place of 5 sentinel sites with a reference laboratory that will make it possible to provide information on the global information system on antimicrobial resistance. Ladies and gentlemen, MADI plans to continue implementing the plan through some priority actions. Inter alia, revision of the national list of essential medicines. The process has just begun. This is in view of integrating award classification, the strengthening of regulations specific to antimicrobial drugs in view of ensuring safe use of antimicrobial drugs in human and animal health, the detection of cases of antimicrobial drug resistance by improving stewardship and diagnosis tools, and also revising the action plan, given that it dates back to 2018 and is supposed to end in 2023. Mali therefore supports the adoption of this strategy and calls on Secretariat to support and sustain progress made and to help states implement actions in antimicrobial resistance actions. Thank you. The floor to Lesotho, Burkina Faso. Prepare.
Excellencies, distinguished guests, Lesotho congratulates the committee for the brilliant report. The Kingdom of Lesotho, like most state parties, has developed antimicrobial resistance plan and currently working towards its adoption and implementation. The Kingdom of Lesotho has recently reviewed essential medicines list and standard treatment guide to combat irrational use of antimicrobial. The Kingdom of Lesotho adopts the strategy and commits to its implementation. I thank you.
Merci.
Thank you. Burkina Faso, you have the floor. Burundi, you will be next. Mr. Chairman, Burkina Faso welcomes this agenda item and congratulates the Secretariat for the quality of the document submitted. Antimicrobial resistance is henceforth considered by the International Committee as an actual public health threat. This situation results in the fact that antimicrobial resistance should be something of the past. Burkina Faso has therefore accelerated implementation and monitoring of National Action Plan to combat antimicrobial resistance in the African region. Implementation of this strategy will make it possible to achieve universal health coverage and achieve sustainable development goals and ensure health security at the global level. In Burkina Faso, the combating of antimicrobial resistance has become a national priority with the adoption of a national multi-sector plan on the combating of antimicrobial resistance 2020-2023. We have set up committees within the One Health Secretariat. Moreover, the setting up in 2018 of the Directorate of Hospital Pharmacy, Directorate of Surveillance of Marketing of Health Products, and the Department of Pharmaceutical Information contributes to combating antimicrobial resistance. Moreover, a new action plan, multinational section plan against antimicrobial resistance 2024-2026 was adopted. It will make it possible to improve the combating and propagation of antimicrobial resistant organisms. So in light of the relevance and content of the document on the regional strategy for expediting the implementation and monitoring of national action plans on antimicrobial resistance 2023-2030 in the WHO African region, the delegation of Burkina Faso recommends the adoption of the document. Thank you. Now I give the floor to the delegate of Burundi. Gambia, prepare, you will be next. Thank you, Mr. Chairman. Mr. Chairman, Burundi congratulates Secretariat for the quality of the report submitted. My country is aware that antimicrobial resistance has become a thorny public health problem and a global health threat. Like many other African countries, Burundi developed a multi-sectoral national plan on antimicrobial resistance 2020-2023. Another plan is in the process of being finalized. In fact, it is a plan that integrates the One Health approach in line with the global plan in view of preventing, slowing down, and controlling the spread of resistant organisms while ensuring availability of antimicrobial drugs that are safe and of guaranteed quality and ensuring that their utilization is optimal. Mr. Chair, with regard to implementation of antimicrobial resistance, my country put in place a multi-sectoral steering committee, including delegates from the Prime Minister's office, delegates from the Ministry of Health, Animal Health, as well as delegates from the WHO-AFRO, and World Animal Health Organization. Since then, sensitization activities have been carried out. It should be noted that a national agency in charge of the quality control of medicines was put in place in Burundi since 2021, and laboratory technicians and bacteriological services were trained. Despite all these efforts, the challenges persist, and WHO support and that of other partners is still needed and required in Burundi. To conclude, Burundi supports the regional strategy for expediting Burundi supports this regional strategy, and is in favor of its adoption. Thank you. The floor to Gambia. Equatorial Guinea, prepare.
Distinguished delegates, in the Gambia, significant resistance to antimicrobial has been reported for various diseases, including tuberculosis, malaria, Helicobacter pylori, and salmonella, to name a few. Despite these challenges, the country has made significant strides in addressing antimicrobial resistance AMR. One notable achievement is the development of a comprehensive costed national plan of action for 2023-2027. This plan is a direct response to the weaknesses and gaps identified through an in-depth situational analysis of AMR conducted in 2021. The Gambia has also taken a proactive stance by launching an AMR action plan and commemorating AMR Awareness Week, thereby fostering greater public understanding. The commitment to capacity building is evident through the successful training of focal points on the global antimicrobial resistance and use surveillance systems GLASS. Additionally, the country has lent its support to the crucial therapeutic efficacy testing of antimicrobials, a vital step in combating resistance strains. These achievements underscore the Gambia's dedication to tackling the multifaceted issues of AMR. Despite these achievements, the Gambia faced significant challenges. The availability of a sustainable source of funding for proactive essential equipment and reagents to combat antimicrobial laboratory surveillance across the 3 identified sites remains inadequate. This financial constraint threatens the continuity and effectiveness of ongoing efforts. The government of the Gambia is actively working to secure the necessary funding to procure equipment and reagents, allowing for the expansion of AMR surveillance to additional sites. The Gambia welcomes the report of the Regional Director and the Secretariat on the new regional strategy for expediting and implementing the monitoring of the National Action Plans and antimicrobial resistance 2023-2030 in the WHO-AFRO region. I thank you for your kind attention.
Merci. La parole est...
Thank you. Equatorial Guinea, you have the floor. Thank you, Chair. When I took the floor the first time, I wanted, on behalf of our delegation, to thank the government of the Republic of Ghana for the warm welcome accorded us on our arrival. We also want to congratulate the Regional Director, Dr. Moiti, and her team for the quality of the organization of the deliberations of the 73rd session of the Regional Committee for Africa. Regarding the regional strategy for expediting the implementation and monitoring of national action plans on antimicrobial resistance 2023-2030, I think this is a priority subject matter in public health. So Equatorial Guinea fully supports this strategy. In that regard, our country has carried out a national survey on the monitoring of antimicrobial resistance. So antimicrobial resistance tracking survey was carried out indeed. We also developed an operational action plan on antimicrobial resistance surveillance. This is still in process and requires the intervention of Ministry of Health and other stakeholders under the One Health approach, working with the Ministry of Livestock, Ministry of Agriculture, and the Ministry of the Environment. We therefore expect to continue to receive support from WHO, notably with regard to capacity development and human resources. Thank you for your attention. Thank you. Distinguished delegates, I don't see any further request for taking the floor by member states of our region, unless Zambia, I thought Zambia had the floor. You want to take the floor a second time, Zambia? Well, I'm sorry, you have the floor.
Zambia commends the Secretariat for considering this important topic to be part of the 73rd session agenda. Zambia, like other countries, did develop its 10-year multi-sectorial national action plan NAP on AMRI 2017. The NAP has facilitated the implementation of various activities following the 5 strategic objectives adopted from the Global Action Plan on AMRI using a One Health strategy. The main focus areas are on increasing awareness and education, infection prevention, upholding, optimizing the use of antimicrobials, and making long-term investments in vaccines, diagnostic equipment, and new medications. Through the AMR Coordinating Committee and with our cooperating partners, the country has operationalized the technical working groups to address the 5 strategic objectives, developed communication strategy. We also developed targeted awareness materials, oriented media personnel and farmers on the prudent use of antimicrobials in the farmer field schools. Further, we have been commemorating World Antimicrobial Awareness Week annually since 2017. We have also strengthened the workforce competences in laboratory diagnosis as part of efforts to improve laboratory surveillance and research, and have trained facility staff and established the antimicrobial stewardship programs in all the 10 provincial hospitals. Despite these successes, we face serious challenges, which include lack of a structured monitoring and evaluation framework to monitor the progress of NAP implementation, and inability to use the standardized tool to cost the NAP activities. Other notable challenges include inadequate community awareness on AMR, inadequate trained staff from key sectors, diagnostic services, infrastructure, limited domestic funding, and the most difficult problem of failure to enforce policies and regulations on antimicrobial use. Easy and uncontrolled access to antimicrobials is a huge problem. Our NAP is presently undergoing midterm review to expedite the implementation and monitoring of national action plans on AMR 2023 to 2030, our approach will encompass the following: establish and strengthen antimicrobial stewardship programs in the human and animal health sectors at all levels, increase the number of laboratory sentinel sites to improve laboratory detection, improve domestic funding, completing the midterm NAP review by incorporating the M&E framework and costing it, increase human resource, work with regulatory authorities to enforce regulations and rules on prudent use of antimicrobial. As Zambia, we are committed to safeguarding the health and well-being of our citizens and future generations, and are happy to endorse the adoption of this strategy. I thank you, Chairperson.
Merci.
Thank you, Zambia. I give the floor to Algeria, and South Sudan will go next. Mr. Chairman, Regional Director, ladies and gentlemen, I have the honor to speak to you on Agenda Item 10, framework for implementing the global for the national for combating AMR. I would firstly like to commend the support and the commitment shown by other member states in combating AMR, because it is truly a public health concern. It therefore needs a concerted action we need a good response to AMR. We need to have a multi-sectoral approach to combating AMR, because we need to look at different areas. We need to look at human health, animal health, and also the environmental aspect as well. So it is the One Health approach that we are adopting there. In this context, we have also been combating AMR, and we would also like to commend the collaboration that we have had between WHO, between UNEP, the World Animal Health Organization, and UNEP. It is therefore very important for us to carry out our development of our national action plans. Although we have taken note of the progress recorded, we think that we need to make sure that we need to look to the issue of finances, and also to look at better diagnostic tools and perhaps vaccines as well, so that we can cover the whole of our territories. And this needs to be done at the regional and global levels. We do think that these national action plans need to be backed up by monitoring and evaluation frameworks at the national level, and these need to be a priority for all of us, for all our countries. Any concerted approach is important for us at the regional level. We need to count on all stakeholders involved. We also think it is very relevant for us to look at other strategies aimed at combating antimicrobial resistance. We must ensure that there is rational use of antibiotics and antimicrobials, so that we can support other initiatives, but also at the same time we must ensure that there is affordability in this context. We need therefore to increase international aid and funding in order to support countries so that they can really objectively and carry out the implementation of their programs only with that technical and financial support. Thank you.
La parole est au délégué de...
Thank you. I give the floor to South Sudan.
Mr. Chairperson, Your Excellencies, distinguished guests, ladies and gentlemen. As South Sudan applauds the Secretariat for submitting this strategy on AMR. South Sudan fully supports the adoption of this AMR strategy. I am pleased to indicate that South Sudan has developed its first National Action Plan 2023, strategic and operational plan that is costed to ensure a smooth and effective implementation of prioritized intervention to prevent and address the challenges of antimicrobial resistance. South Sudan has formed AMR technical working groups with clear TORs to support and monitor implementation of the AMR activities. South Sudan underscores the need to use One Health approach and applications of all the necessary guidelines and regulations to combat misuse of antimicrobial and counterfeit medication at all levels of health care delivery in the country. In conclusion, Mr. Chairperson, for a smooth and successful implementation of this strategy, South Sudan would like to encourage the Secretariat to continue supporting member states to ensure integration and building national resilient and sustainable health system. Thank you.
Merci.
Thank you, distinguished delegate. We shall now adjourn our discussions to have a coffee or tea break, and we will resume at 11 o'clock on the dot.
C'est comme si personne ne veut prendre de pause café.
Please, we have our break now, our health break.
I can tell you, we were prepared for it, and yes, WHO played a lot of role in that. We had the manpower available, and then the timing and the funds and the local materials were then provided. So everything, I think, was just in place to just be able to produce a commodity that will be effective against microbial infections. I was lucky to be a part of this team. We came and then we did the training. I think it was a Zimbabwean that trained us, an expert from Zimbabwe. We were trained to the concepts, the principle, and then we also came and did the practicals where we produced alcohol-based hand rub to the tune of 82%, 83%, 79%. But actually, our target was 75 to 85%. That is 80% baseline, plus or minus 5%. So I believe compliance and continuous usage of these products will help to minimize these cross-infections and other infectious products that will be prevented by hand hygiene.
In a country like Sierra Leone, where there are so many resource constraints, and where very quickly we realize that the combination of the responses that we required to have COVID-19 under control was to have vaccination available to as many Sierra Leoneans as possible. WHO was also central in the support that the UN provided to the government and people of Sierra Leone. Firstly, through the COVAX facility, and so the first consignment of vaccines that were deployed through the national COVID vaccination program. WHO played a role, of course, with UNICEF in enabling those consignments to get into the country and rolling out the vaccination, national COVID vaccination program. One of the things that you will notice with our response here in Sierra Leone is that we've had to rely on a surge approach. So every now and then, a major campaign is undertaken where we take the vaccines to the people in the communities and not wait for them to come to health facilities or vaccination centers to receive the vaccine because of the ongoing challenges with misinformation and all kinds of myths. But we do know, and we have the experience here in Sierra Leone, that once you take the vaccine to the people, they would bring out their arms to take the vaccines.
With COVID, when vaccines became available and all of these mitigation measures were available, and you have the population in your corner working with you, we're able to contain the situation a lot better than other countries.
ana atatu. Wina anabadwa mu 2017, wina yo mu 2019, uyo ndiye muno ma 2 kena kumene kujatira njira tisamala bwinobwino kubwera kuno china chonse chimayenda mwadongosolo bwinobwino panalibe chovuta. Ndiye ndikuona kuti pamene waja mu 2017 ndi pano zikusiyana kuti pano zikuyenda bwino. Zinthu zimene zikuyenda bwino pa chipatala pano. 1 akugawa bwino mankhwala, 2 akutira njira bwinobwino mapatient, akumaitenga ndife mapatient awo. China chonse chikuyenda bwino matresho abwino, mabedi anywani, koma poyamba mabedi analopasuka, ena ofutika, koma pano china chonse nichotheka. Ndiye ndikuona kuti zonse zikuyenda bwino.
Sanje Decho started implementing quality of care a few years ago. So far, we have had trainings about quality improvement, which led to the formation of cysts and also the weeds in the ward, which also led to us having projects in the wards, depending on the ward problems, what we really want to achieve in the ward. So ever since we started implementing the quality improvement projects, we have had trainings supported by WHO, mentorships. We have also had supervisions from people coming from WHO, and they have also been providing us with some supplies and materials, which also helped us to implement the different projects that are happening in the wards. So far we have seen a positive impact because of the quality improvement project. For example, we've seen that now women in labor are being monitored. We have some projects whereby we want to check the HB level for all pregnant women. We are able now to find out if the woman has anemia so that we can easily help the woman to prevent the complications that occurs during labor and delivery.
Demandira mavuto ambiri amene amachitika pa chipatala pano kalekale lomwe anthu tikapita m'makomuniti mwina tikapita aponisa misonkhano kwa gurupu zowafotokozera zawo kufunika zobwera kuno kuchipatala anthuso amapereka mavuto awo. Ndeni pang'ono ndi pang'ono azimati anayamba kuzolowera akangozindikira kuti ayima amathamangira kubwera kuchipatala kuno.
There are a number of services, health services that we give out to the community. We talk of general services like at the outpatient department where we have patients. So we prescribe drugs according to their conditions. We also have HIV testing services. We have family planning services. We also have immunization services. So there are a number of services that we have here. The community mostly look at how you give them the service. That's the first thing. So they look at how positive you are to them, what's your attitude and to them. Those are the things that they look at. And even the cleanliness of the facility itself is one of the things they look at.
The partnership which we have between the government of Malawi and the World Health Organization is such a strong partnership. We have such strong coordination and collaboration to the point that sometimes people they mistake WHO staff to be part of the Ministry of Health because of the strong relationship which we have.
Proud that the region have been doing quite well with immunization, but the moment COVID hit in 2020, our graphs show that we had a little dip. And I think it was wholly due to the fact that there was a lot of fear and panic in the system. People didn't want to come out to be able to get the infection. WHO supported us enormously to be able to reach our missed children. So they supported us with a lot of funds. And with these funds, we were able to rent a lot of books to go to the island.
We have been going for island services, sometimes even 4 times a month, so that we can be able to cover up for those gaps that were there.
Ena be wen de devinin
we wo de vi na mi ovi onye be gbai kple atatutu do ye tana be we wo de evi na mi le mion to ye ma ha do le ma de ke ma gavali le we de denti.
WHO is investing in ensuring that appropriate logistics are available for healthcare workers to reach every child and deliver the much-needed immunization services.
Nous allons renforcer la capacité des agents de santé sur le terrain. Au niveau de la périphérie, une sage-femme ou un infirmier qui a été formé peut déjà, devant une complication du postpartum, une complication, peut déjà réagir.
Les sages-femmes, après une évaluation avec l'outil de l'OMS, elles ont vu elles-mêmes les forces et les faiblesses dans la prise en charge de nos mères et de nos nouveau-nés, de nos enfants. Et elles ont fait un plan d'amélioration de la qualité des soins.
As if I'm talking.
De mettre en place de chariot d'urgence. Un chariot d'urgence pour pouvoir avoir des médicaments pour les urgences obstétricales, pour les urgences néonatales, et faire en sorte qu'il y ait même tous les protocoles et les standards qui soient affichés et faire en sorte que les soins soient davantage humanisés.
Nous avons mis en place un protocole qui consiste à se rassurer que les recommandations que nous laissons à chaque visite mensuelle, est-ce qu'elles sont appliquées. On veut se rassurer que la trousse d'urgence est toujours prête, parce qu'une trousse d'urgence, son objectif c'est quoi? C'est de mettre à la disposition les médicaments de première nécessité en cas de complications, pour ne pas qu'on soit encore amené à courir, voilà. Donc on essaie d'anticiper.
Les questions qu'on pose, on est en train de préparer la femme à l'accouchement, c'est-à-dire le plan d'accouchement pour qu'il n'y ait pas de complications au cours de la grossesse et au cours de l'accouchement. Maintenant, il faut savoir si ces femmes-là, si elles vont accoucher ici dans le centre d'abord, et savoir si la femme, si elle n'est pas loin de l'hôpital, si l'accès est facile pour elle pour venir à l'hôpital. C'est un premier point d'abord. Et si elle a marqué, il n'y a pas de véhicule pour la transporter, elle peut faire un domicile accoucher là-bas et puis il peut y avoir des complications. Cette dame-là, si son mari n'est pas véhiculé et si c'est tard dans la nuit, comment faire pour l'envoyer à l'hôpital? Tout ce qu'on explique à la femme, on la prépare pour un bon accouchement et puis pour éviter les décès maternels.
Mais l'OMS nous a appuyé techniquement comme financièrement à mettre les points nouveau-nés dans les salles d'accouchement. C'est l'OMS qui nous a permis d'avoir tous les chariots d'urgence que les sages-femmes souhaitaient avoir. C'est l'OMS qui nous a permis d'avoir tous les protocoles, les standards de prise en charge de nouveau-nés, des mères, pour pouvoir les afficher, les diffuser et puis disséminer. Parce que la dissémination consiste à les former aussi à la mise en application de tous ces protocoles.
Il y a eu des investissements massifs qui ont été faits par le gouvernement avec l'appui de ses partenaires dans l'OMS pour remettre à niveau le plateau technique et les infrastructures. Mais il y a eu quand même des projets spécifiques, ciblés sur la mère et l'enfant, notamment les SOMI, qui permettent donc de prendre en charge donc, de façon rapprochée ces populations. Et surtout, il y a la promotion de la santé avec donc, les consultations prénatales, l'appui donc, des communautés donc, dans la sensibilisation des femmes Et tout cela a contribué donc à réduire de façon substantielle donc, le taux de mortalité. Mais nous voulons aller plus loin. Aujourd'hui, donc, à travers le pays, nous sommes en train de construire donc, des blocs gynéco-obstétriques un peu partout pour rapprocher donc, la prise en charge des parturientes, mais également déployer davantage donc, de gynécologues pour agir là où il faut.
Nous sommes fiers de mettre tout ce paquet technique à contribution pour le pays qui est la Côte d'Ivoire. Nous sommes fiers également de voir cette masse critique des professionnels de la santé de plus en plus confiants. Pourquoi? Parce qu'ils ont les capacités techniques nécessaires. Ils n'ont plus peur de donner les soins. Ils n'ont plus peur de parler aux femmes. Et c'est ça qui fait la fierté de l'OMS. Et nous allons continuer dans ce sens. Aucune femme ne doit mourir en donnant la vie.
On est au sommet, on reste au sommet, toujours au sommet, on reste au sommet. Attention, attention, on s'accroche.
We have to stop this scourge because it is killing our people. It is robbing us as a nation of productive citizens and robbing families of their loved ones. Our response to the outbreak as government started a while back because even the World Health Organization recommends that the cholera vaccine should only be used as an additional intervention in cholera control.
Kolera inatikhudza pakhomo pathu abambo atadwala matenda akolera. Pakhomo pathu takhudzika kwambiri pachifukwa chonena kuti munthu amene anali oti ngati woyimirira khomo lija kugawo ngati losokola plasi zina ndi zina ngati mdindo pakhomo paja palibepo. Ndiye zimene zidakhala ngati zidabweretsa mavuto ambiri pakhomo paja.
The first case of cholera was on 22 November. It was a family. By then, we were not really prepared. We had only one small tent. This tent only could occupy 6 patients. So since 22 November, we had a lot of cases having admissions of 20 to 30 in 24 hours at this facility. We are really overwhelmed when the cholera cases were coming. We also had a shortage of both human and material resources.
Chaka chino kolera wativuta kwambiri. Ndikumbukira kolera amene kuno kwathu kwakauma adayamba mu January, February. Tuma zimeneyi inakhala ndi makesi kapena kuti mapatient okwana 11 ndipo anthu atatu anali atamwalira.
In our community, as Namitete, we have a grouping we call Pastors Fraternal. After we were trained by World Health Organization with Ministry of Health, then we took this information and gave to all our member churches in the Fraternal.
I should be able to recall the issue of the response we have had and support from WHO previously in the previous cholera outbreaks. Like I indicated, it has actually been the issue of if they are able to give us the resources, fuel, for us to be able to go out into the communities affected or districts affected, and to actually give us the technical guidance. So in the form of preparedness part, or you are in class, or there is cholera, let us mount training. So
over the years, WHO senior leaders across the organization have sought to find a common way of constantly improving their leadership skills. The Pathways to Leadership for Health Transformation program is one such program aimed at enhancing leadership skills whilst at the same time fostering inter-regional collaboration and driving impactful change across the organization and ultimately within the global healthcare landscape. The Pathways to Leadership program was originally curated by the AFRO region. In collaboration with Redma Consultants, the Pathways to Leadership program has now widened its scope to include the European Regional Office, Euro.
We can learn a lot from all of you in your beautiful region.
And most recently, the East Mediterranean Regional Office, EMRO.
We in AFRO, we are so excited about our close collaboration with Europe.
The interregional collaborative cohorts of the Pathways to Leadership program are now in their third year, with the most recent cohort held on 27th to 30th June 2023 in Dar es Salaam, Tanzania. The four-day face-to-face element of the workshop in Dar es Salaam gathered 26 staff comprising existing and prospective WRs from the African and European regions. The training provided participants with the skills needed to address the difficult problems encountered by WHO country offices, while concurrently acting as a catalyst for both personal and professional growth. The program encouraged participants to embrace innovation, diversity, and resilience in their efforts to advance public health in Europe and Africa, with a focus on transformational leadership. One of the highlights of the workshop was the opportunity for representatives from Euro and Afro regions to collaborate and exchange knowledge and experiences.
We people, we tend actually to forget what others say. We also tend to forget what others did. But what we remember is actually how we felt throughout a joint, let's say, undertaking. And the whole training was actually about, among other things, of course, but about teaching us how to lead our teams, how to manage our teams in a way that our team members basically feel included and that they feel safe and that they feel that there is a common mission that they can always actually contribute to.
Working together across the two regions to find common solutions to common problems is a great, great collaboration. And I'm hoping, moving forward, that more regions can actually come together, that we can have WRS and candidate WRS from all the 6 regions, or whatever number of regions. I think this is a good practice that should be moved forward.
I think I've been part of many different trainings, and I think what is unique about this one is that it's very context-specific. It's been tailored to our needs as either WRs or upcoming WRs. And I think, again, that requires different tools. And I think those tools have been presented to us, and we've had the opportunity to really think about them in a very practical manner as well. So it's not just been about the theory, but it's actually also been about applying those. And this is a journey. So, of course, this has just been the first part of the journey, and we will continue that journey.
The fact that representatives from 2 different regions, Afro and Euro, were brought together was a terrific opportunity to compare cultures, approaches, thoughts from 2 different regions, compare notes, and leverage the best out of the discussions. And whenever you bring WRs and senior staff together, it is also an opportunity for us to compare notes, to ask each other questions, to learn from each other, learn the different experiences, and that's what makes a workshop interesting, and this one was a perfect opportunity for that.
So I've been in many regions. I haven't worked in AFRO. It was a privilege to see how the AFRO WRs operate and some of the ideas that have come from there. But what you realize is we're all really pretty much the same. We may have slightly different contexts, and our specific problems might be somewhat different, but in reality, the people management, the self-management, the leadership, the partnerships, everything that we deal with as WRs is the same, regardless of the region you're in.
So this has been extremely excellent and one of the best workshops that I think we have had. For me, that has been really, really enriching. And the mix with the Euro colleagues is just but the icing on top of the cake.
This is quite different. When we had colleagues from both Afro and Euro, we were able to hear different perspectives, great experiences in terms of how people have been managing, leading teams, but also bringing in the perspective of the different country contexts that people are working in, as well as the context in terms of culture
for that particular region. So it has really, really been very enriching.
This training shows us the need to not be competitive within countries, but to work on collaborative manner to learn from each other to improve the overall WHO reputation.
For me, working in a small country office in Euro region, it is an extra bonus to have an opportunity to meet and learn from and with colleagues from other regions. This time it was Afro region.
The training workshop featured a diverse range of interactive sessions led by renowned experts in leadership development and global health. Through engaging presentations, case studies, simulation, and group activities, participants gained insights on effective communication, strategic decision-making, and the art of influencing positive change within the organization and in communities. The knowledge and skills acquired during this intensive workshop will undoubtedly strengthen the capacity of WRs. These empowered leaders will play a pivotal role in shaping the future of global health, driving progress towards the Sustainable Development Goals and ensuring equitable access to quality healthcare for all.
Through the Pathways to Leadership program, the Afro Transformation Team and the Euro Staff Development and Learning Teams are committed to making WHO leaders fit for purpose at regional and country levels.
On average, every working Zimbabwean spends about 1/3 of their lives at work, which is a lot of time for individuals to be exposed to work-related stresses. This can lead to chronic stress, anxiety, and depression. Yet, there is little to no mental
The WHO leadership program was for 4 months. It granted me the opportunity to be trained in certain skills. It afforded me an opportunity for once to be assessed and rated. They took us through a 360 feedback assessment, and they gave us candid opinions about ourselves. Generally brought to the fore what needed to be enhanced and what needed to be looked at differently. The style of delivery of the program by the facilitators, it was very unique and very participatory. It brought out teamwork and it helped us to work in cohesion. I have built my emotional intelligence in the essence that I listen more, applauding staff and giving them a pat on the back. Coaching and mentoring has also been one of the benefits I'm being able to apply from this program.
It's been an inspiring figure in putting together the strategic plan and other work programs.
This program taught us to look at our strengths and to look at how we could sharpen those strengths, because you think that already I'm good in this area, but how can you make your good better and your better best?
WHO, working with the Ministry of Health, with funding from the United Kingdom Department of Health and Social Care, have contributed to nurturing a new breed of agile health workers for whom learning and self-reflection
Thank you.
constitutes their ways of working.
Let me take this opportunity to thank the second vice chair for chairing this morning's session, and welcome back from the health break, distinguished delegates. I do not see any other requests by member states. I therefore shall now give the floor to member states from other regions, followed by UN and other IGO's representatives who have 2 minutes to their statements. I don't see any requests. I shall now open the floor to the non-state actors who have requested to deliver a statement. You have 1 minute. We shall start with the International Alliance of Patients Organizations, followed by the International Federation of Medical Student Associations.
Mr. Chairperson, Honorable Ministers, distinguished guests, the International Alliance of Patients Organizations, IAPO, on behalf of which almost 300 member organizations and alliances from 74 countries covering 52 disease areas, welcome and endorse the proposed regional strategy for expediting the implementation and monitoring of the National Action Plans on AMR. In August last year, IAPO and Swiss-based IAPO Patient for Patient Safety Observatory supported the establishment of the African Regional Chapter of AMR Patients Alliance, a platform to bring together patient organizations and disease alliances from the region to collectively collaborate in the fight against AMR. The Africa AMR chapter safeguards the same principles and priorities defined in the whole regional strategy and standards, and stands by ready to engage in its implementation at national and regional levels. Plans are underway to fully operationalize the functioning of the chapter. IAPO implores member states to ensure that the implementation of the regional strategy on AMR 2023-2030 fully engage patients, their families, caregivers, patient organizations, and citizens at large in promoting prudent antimicrobial use in both human and veterinary medicine, as well as access to innovative, safe, and quality medicines. With the dry innovation pipeline of antibiotics, we need to preserve the effectiveness of existing antibiotics for as long as possible and for as many patients as possible. Patient and civil society organizations are invaluable partners in ensuring sustainable implementation of AMR-related policies and actions, and as such, they need to be more significantly involved in the regional strategy
Please
and national action plan.
Complete.
We therefore urge the whole Africa Regional Community to consider mainstreaming patient and citizen engagement in the fight against AMR and adopt this strategy. I thank you for your attention.
Thank you. Please remember you have 1 minute. I now give the floor to the International Federation of Medical Students Association, to be followed by the International Pharmaceutical Students Federation.
Honorable Chairperson, distinguished delegates, the International Federation of Medical Students Associations acknowledges the work done by the African member states and the regional office in the fight against AMR, which is a silent pandemic and a global health issue of concern, particularly in our region. The IFMSA, we are dedicated to involving medical students in research and addressing the issues that affect their health, encouraging innovation through collaborative problem solving, and the creation of policies that ensure these topics are well documented, deliberated, and acted upon. IFMSA would also like to strongly emphasize the role of the youth, and we call upon WHO and member states to ensure that health students who represent the future workforce are given an essential role in the regional movement towards combating AMR and ultimately achieving UHC. Thank you.
Thank you. I now give the floor to the International Pharmaceutical Students Federation, to be followed by Medicine for Malaria Venture.
Honorable Chair, distinguished delegates, it's a great honor to speak on behalf of the International Pharmaceutical Student Federation, IPSF, which represents more than 500,000 pharmacy students and recent graduates worldwide. IPSF commend WHO on the regional strategy to expediting the implementation of monitoring of National Action Plan, NAP, on antimicrobial resistance 2023-2030 in the WHO African region, with 96% of member states developing NAPs. IPSF continues to prioritize AMR by developing an AMR advocacy toolkit, providing guidance to member organizations to create awareness locally. Using One Health approach, IPSF African Regional Office organized a discussion on AMR with medical, veterinary, and agricultural students. Due to the low place of developing new antimicrobial, IPSF called on WHO member states to leverage on youth and innovation to identify scalable and effective means of regulating antibiotics in member states through technology. We also urge member states to ensure the inclusion of One Health approach in pharmacy curricula and promote multidisciplinary approach in the fight against AMR. Thank you.
Thank you. Medicine for Malaria Venture, the floor is yours. We can't hear you, Medicine for Malaria Venture.
Please, can you hear me?
We can, yeah.
Please, can you hear me?
Yes, we can. Go ahead, please.
Yes, thank you. All right. Sorry. We'd like to highlight the need to forcefully address anti-malarial drug resistance in line with the new WHO strategy. In 2021, WHO reported over 245 million malaria cases and 619,000 malaria deaths worldwide. The growing threat and spread of the partial resistance of malaria parasites to artemisinin-based combination therapies in some African countries could result in a public health catastrophe if mitigation measures are not taken now. To overcome this threat, several partners formed the African Leadership for ACT Resistance Mitigation, or the ALARM Consortium, which includes 13 African countries who want to take proactive steps to fight off resistance by piloting and expanding the use of multiple first-line therapies in their countries. We have also worked together with partners to develop the next generation of non-artemisinin-based combination therapies on NACTs to support the development of triple artemisinin-based combination therapies. We're also working closely with funders and manufacturers to ensure that today and tomorrow's medicines for malaria will be affordable as possible and to provide innovations to speed up access to next generation medicines. We are asking the African states to play a key role to support country level mitigation and resistance mitigation efforts to procure effective medicines in the face of looming drug resistance, and to support African-driven solutions such as the ALARM Consortium. Thank you very much, Mr. Chair.
Thank you for your statements. I have no more speakers on my list. Are there any comments from the Secretariat on the issues raised?
Yes, thank you, Chairperson. Distinguished delegates, thank you for the interventions and truly rich discussion that we've been part of. I think we have had almost over 30 interventions from member states. What has really been, I think what has stood out from the interventions is the extent to which there's such a high commitment and interest from member states in addressing this health and security threat. Also, I think it's quite clear from the interventions that this is an area which is really vastly cross-cutting, multifaceted, and requiring an approach that addresses this very vast cross-cutting approach to AMR. We have appreciated many of the points, most of the points, in fact, all the points that have been raised, very, very rich points. For instance, just to mention a few, the need for resilient health systems has been emphasized. Access to antimicrobials, especially for low middle income countries, and in our region, the vast majority. But alongside the importance of ensuring access to antimicrobials, the need, of course, to be monitoring misuse, overprescription, and so on. So it's sort of a perspective from both ends. We've also, I think, a great emphasis on preserving the medicines that we do have, HIV, TB, and other medicines, and that this approach intersecting with the other approaches, other programs is going to be very important in that regard.
The intersection with WASH, IPC, the quadripartite approach, these have all been emphasized. I'd also like to mention the call, very strong call for financing. And this is really important because, as we have said, that if we're going to be able to address such a vast, broad area, cross-cutting, financing is very important. And we've heard from member states the importance of support, technical support from WHO, some financial support, but also reaching out to partners in that regard. So that we feel is very important. And from the SIDS countries, we do hear the call for additional support for SIDS countries in technical support. In the same vein, of course, we'll be supporting other countries. So the message that is coming through is very clear, from member states, and we really appreciate the enthusiasm, support, and the work, the great deal of work that is taking place. I think, though, that we've just been discussing and looking at the vastness of the challenge that is ahead of us, and that we do need to accelerate implementation of these various programs, working, of course, with other partners, civil society, NGOs, and so on. So really from a secretariat, just to thank you for those. For those interventions. I'm joined by my colleague, the technical lead for AMR, who was on standby for questions, but I think we didn't really have questions, but really a great set of interventions in terms of how we can improve various areas. I mean, for instance, regulations, governance. There are too many to mention, but just to thank you all for these interventions, and we will certainly, from Secretariat and WHO, be working at country level with headquarters and the regional office in ensuring that we can provide the sort of support that we can for member states to implement these programs. And so we look forward to working with you in that regard. Chair, I'll end here and hand over to you. Thank you very much.
Thank you. Shall I take it that the Secretariat has taken note of the comments and that the Regional Committee is ready to adopt the resolution contained in AFR/RC72/WP1, which includes adoption of the regional strategy for expediting the implementation and monitoring of national action plans on antimicrobial resistance out of 2023 to 2030 in the WHO African region, as contained in document AFR/RC73/6. It is so decided. Thank you all for your important contributions. And this brings us to the end of the discussion of agenda item 10. We will now move to agenda item under Pillar 1. That is agenda item 8. Framework for implementing the global strategic directions for nursing and midwifery out of 2021 to 2025 in the WHO African region, which is contained in document AFR/RC73/4. May I invite Dr. James Asamani, the team lead and the health workforce, to present the document. Over to you, Dr. Asamani. You have 5 minutes.
This document, Framework for Implementing the Global Strategic Direction for Nursing and Midwifery 2021 to 2025 in the WHO African region, I present on behalf of the Secretariat. Next slide. Mr. Chair, before COVID-19, it was estimated that 50% of investment needed to achieve the SDGs needed to be spent on the health workforce. And this has even now been reinforced in the aftermath of the pandemic. And we do know that in the African region, more than 50% of our workforce are nurses and midwives, of whom 65% are women. And these are very critical in helping us to achieve universal health coverage and strengthen our system for health security. We also know that increasing changes in epidemiology, economic situation, climate change, and humanitarian situations are modifying the need for health services and therefore increasing the need for health workers, particularly nurses and midwives. So this framework is intended to guide member states to align and stimulate and sustain adequate investments in nursing and midwifery as part of the broader health workforce. Next slide, please. Mr. Chair, as of 2018, there were more than 2,300 schools and colleges training nurses and midwives in the region, over 60,000 per year. However, the quality of the training is also a source of concern, particularly as it relates to specialized training for nurses and midwives at the postgraduate level. Most of them are lacking standardization. Next. Mr. Chair, we've however made some progress. If you compare 2005, we had roughly 12 nurses and midwives per 10,000 people. This has improved to almost 18 per 10,000 people in 2020. But the region continues to face a shortfall of nearly 3 million nurses by 2030 if we have to achieve our targets for UHC and health security. Next. The key issue is that our investment in the employment of nurses is not keeping pace also with our training output. For example, about 30% of our recent graduates of nurses and midwives are facing unemployment or underemployment, and the fiscal constraints are also impeding our capacity to retain our nurses and midwives, and most of whom are migrating in recent times. For example, there is a fourfold increase in migration in many countries since 2019. Next slide. So the framework proposes 4 strategic directions. The first one is to align and expand nursing and midwifery education and training in line with the population health needs. In so doing, we'll address gaps in specialized nursing and midwifery skills and also focusing on primary health care, especially in rural and underserved areas. And number 2 is to stimulate and sustain investments in decent employment for nurses and midwives by ensuring that we optimize planning and resource allocation, enhancing employment and decent working conditions, and ensuring that our nurses and midwives can be retained. Next slide, please. Number 3 is to strengthen nursing and midwifery leadership, regulation, and monitoring and evaluation to ensure that what we put in can really lead to the intended actions that we want to achieve. And finally, is to optimize nursing and midwifery practice, innovation, and research by promoting adequate scope of practice that allow nurses and midwives to practice to the full extent of their knowledge, and then stimulating and systematically documenting their innovations through research. I thank you so much, Mr. Chair, and we are inviting the regional committee to consider these strategic directions and potentially adopt them. Thank you.
Thank you very much. I now open the floor to member states' interventions. Tanzania, you have the floor, followed by Uganda.
Chairperson, the United Republic of Tanzania aligns itself with the framework for implementing the global strategic directions for nursing and midwifery and commends the significant work done in settling the implementation framework. Nursing and midwifery workforce has remained as one of the key pillars in the provision of health services in the country, accounting for about 60% of the human resource for health and implementing over 80% of the healthcare services. To meet health-related SDGs, as well as UHC, it is important to ensure the availability of competent and well-motivated nursing and midwifery workforce at the primary healthcare level. Chairperson, we have noted a significant global commitment to maximizing the nursing and midwifery workforce in bringing positive health outcomes through strengthening training, deployment, and working conditions, as well as engaging the cadre in decision-making at all levels. The country will ensure a similar commitment to improve the quality of healthcare services. Chairperson, the first ever State of the World's Nursing Report of 2020 and the State of World Midwifery Report of 2021 provides information on critical areas that need to be discussed and addressed. We are taking these as useful resources as we move in enhancing the availability of quality and accessible essential health services, particularly in hard-to-reach areas. Tanzania continues to improve competence-based training through improving the curricula and the infrastructure of existing colleges for nursing and midwifery cadres. However, a well-designed, patient-centered care, standard operating procedures, tools, and guidelines have already been introduced to healthcare facilities to ensure provision of quality healthcare services. Tanzania will commit more efforts to ensure increased training and deployment of specialized nurses and midwives, as well as intensifying the involvement of the cadre in decision-making by building capacity to nurse leaders at all levels, including strengthening accountability for quality service delivery. We take note of the report and approve the streamlined framework for implementing the global strategic directions for nursing and midwifery 2021-2025 in the WHO African region as it guides the country in efforts to improve nursing and midwifery services within the member states. Thank you, Chair.
Thank you, Tanzania. Uganda to be followed by Angola.
Thank you very much, Chair. Chair, Uganda welcomes the framework and its 4 proposed strategies. And we are aware that reaching the WHO requirement of patient-to-nurse ratio will take our continent some time. However, as we train nurses and midwives, a big number migrate to more developed markets in search of opportunity, which our economies cannot optimally provide. Destination countries of migrating nurses and midwives from Africa should comply with the provisions of the WHO Code on the international recruitment of health personnel rather than poaching through backdoor on our personnel. National schemes of services for nurses and midwives have not kept pace with other categories of cadres, principally doctors, despite nurses and midwives being numerically the largest workforce in service delivery. This widens the deficit of nurses and midwives in our region. The global shortage of health workers, together with economic, demographic, and security realities, make immigration of nurses and midwives and other categories of health workers inevitable. We must collectively develop and implement innovative mechanisms to competitively compensate nurses and midwives so as to retain them in our health systems. The establishment of human resource observatories that provide accurate data on human resources for health production, skilling, deployment, compensation, and mobility is a key preliminary requirement for optimal planning and management of the health workforce. I call upon the WHO Secretariat to continue to prioritize support to member states in developing robust, regularly updated human resources for health observatories. Uganda looks forward to the finalization and supports the implementation of the African Health Workforce Investment Chapter currently being developed by the WHO Africa region. I thank you, Chair.
Thank you, Uganda. Angola to be followed by Botswana.
Mr. Chairman, of the 73rd session of the Regional Committee for Africa, Ministers of Health, distinguished guests at this august assembly, the Angolan delegation would warmly like to greet all members, states of the Regional Committee, and we would like to congratulate the Regional Director for this important agenda item which is on the table before us, because human resources is absolutely essential for us in the health arena. Angola has come up with a human resources health plan and strategy for 2013 to 2025. We are working hard on developing our human resources for health in this regard. And over the last 5 years, we have more than 41,000 health personnel. We have more than 3,000 doctors. more than 24,000 nurses, and then 7,000 plus health technicians. We have a specialist training program in the pipeline in order to help us increase and our efficiency at the 3 levels of the health pyramid. We have primary health care. We also want to cover and improve our UHC. In 2020, we carried out specialist training for nurses, and 128 technicals, especially the midwives, were trained in this regard. In terms of other specialist trainings, we have been focusing on midwives, pediatric nurses, those who deal with data analysis, resuscitations, intensive care, and so on. From 2027 on, we will be training a lot more nurses as well. Our objective is to improve the professionalism of all our health personnel so that we can do away with inequalities and make sure that we are making progress on the road towards achieving UHC. Angola would like to support the implementation of this global strategic directions for nursing and midwifery 2021 to 25 in the WHO African region. Thank you.
Botswana to be followed by Liberia.
Chairperson, Botswana welcomes the report of the Secretariat and the proposed framework for implementing the Global Strategic Direction for Nursing and Midwifery 2021-2025 in the WHO Africa region. Botswana welcomes the 4 strategic directions espoused in the strategy, as they will contribute towards strengthening the nursing and midwifery professions, particularly in the areas of training in line with population health needs, leadership, regulation, as well as research and development, to name but a few. In response to WHO 7330, which requested WHO to engage with all WHO regions to update the Global Strategic Direction for Nursing and Midwifery 2016-2022, and following consultation with member states, submit this update to the 74th World Health Assembly, Botswana responded by developing their first ever Nursing and Midwifery Strategic Plan 2020-2024. The strategy articulates the commitment of the government of Botswana to transform the nursing and midwifery professions and focus on core business of providing strategic evidence-informed interventions which are inclusive, participatory, and relevant to their clients. Through implementation of the nursing and midwifery strategy, Botswana has made great strides, notably in the areas of leadership, regulation, education, and training. There is strengthened senior nursing and midwifery leadership at policy and district level. Professional regulatory systems continue to be reviewed to enhance service delivery. Education programs are being redesigned for effective learning towards better health service delivery. The government has made a deliberate effort to increase the training budget and numbers of nurses and midwives being trained at advanced and specialization levels. More work in the strategy still remains, particularly in the areas of research, workforce, and human resource for health information. In conclusion, Chairperson, Botswana supports the adoption of the proposed framework and commits to its operationalization thereof. I thank you.
Thank you, Botswana. Liberia to be followed by Zambia.
Good morning, Chairperson, and good morning to all our colleagues. Liberia aligns with this strategy and have taken some steps towards improving its system. Liberia have launched a new policy on strengthening the education and training of nurses and midwives. First, by accreditation of nursing schools around the country to make sure they are teaching the right or have the right type of program. Our examination process for licensure have been digitalized to help the students to be more accurate. Schools have been upgraded to bachelor's and master's level, and more specialization programs have been put in place in and out of the country. The salary scales for the profession have been in the process of being upgraded with added amenities to keep the nurses and the midwives within the country. Liberia is improving its primary health care system, and nurses and midwives are the building block. So therefore, we want to make sure that we retain them within the country. Liberia wants to thank the Secretariat for this strategy, and we will continue to work towards this 2025 strategic plan. I thank you.
Thank you, Liberia. Zambia to be followed by Togo.
Thank you, Chairperson. Zambia is grateful for the opportunity to contribute to this very important agenda item. We want to start by commending the Secretariat for the inclusion of this subject on the agenda of this meeting. We also wish to take this opportunity to acknowledge and appreciate all the nurses and midwives for their contribution to the health sector. As a country, we have made considerable progress in all the 4 strategic directions of the framework. For example, under Strategic Direction Number 1, Zambia, through the Nurses and Midwives Act Number 10 of 2019, has provided for the Nurses and Midwifery Council the mandate to approve nursing and midwifery education and training programs for both public and private training institutions, thereby increasing training opportunities to access nursing and midwifery education and training. We continue to develop additional new curricula to apply for more specialized care, including the provision for pre-service students to train in a number of specialized areas such as midwifery, pediatrics, and public health nursing as a means of responding to population needs for specialized nursing and midwifery care. Under Strategic Direction Number 2, the government of Zambia has continued to be the main employer of nurses and midwives in the country, while acknowledging the role of the private sector, which has also developed significantly. In 2022 alone, the government, in an unprecedented employment exercise of healthcare workers countrywide, employed over 12,000 healthcare workers, out of which over 40% were nurses and midwives. In the same year, over 3,000 nurses and midwives were promoted, a move that was meant to motivate our staff. A similar exercise is also planned for this year, 2023. Under Strategic Direction 3, we are happy to report that there exists a Department of Nursing and Midwifery Services since 2017 at the Ministry of Health. We are currently working with various partners to improve leadership skills of nurses and midwives by adding leadership courses to the existing nursing curriculum. Under Strategic Direction 4, the Nursing and Midwifery Council has just finalized the development of a scope of practice that is aimed at enhancing research activities among the nurses and midwives in the country. Chairperson, despite the successes recorded, we have challenges which continue to exist. For example, we continue to face shortages of nurses and midwives due to the continued brain drain, as highlighted in the report, coupled with our country's limited fiscal space, which limits the numbers that can be employed at any given time. We therefore welcome continued engagements and enhanced collaborations with WHO Secretariat and other stakeholders to partner with us in our continued strive to improve the status of nursing and midwifery in our country. With this, Zambia is happy to endorse the adoption of this framework. I thank you.
Thank you, Zambia. Togo to be followed by Seychelles.
Thank you, Chairperson. Togo would like to congratulate the Secretariat for the quality of this framework. Togo appreciates the progress made by all countries in the implementation of the global strategic directions for nursing and midwifery. Togo has 13 public paramedical training schools, which contribute to providing the healthcare facilities with nurses, midwives, and health assistants. And they are showing their expertise because they have produced more than 500 paramedicals every year. However, their recruitment by the public sector following their graduation is not regular. and this encourages other professionals internally and externally. We're also confronted with major challenges such as provision of simulation equipment for the training schools, building of public of rooms, operation rooms, and upgrading of trainers so as to provide efficient, updated training and regular recruitment of trained paramedicals after their 3 years of training. Togo would like to thank the WHO for its support, which has made it possible to improve the quality of training and to ensure continuous training for nurses and midwives. Togo approves the framework and hopes that networking among member states and health innovations will make it possible to rapidly attain the objectives of the framework by 2025. Thank you, Chairperson.
Thank you, Togo. Seychelles to be followed by Central African Republic.
So, Mr. Chair, nurses and midwives are the backbone of the Seychelles primary healthcare system. Reaching the public health targets for infant and maternal survival and immunization coverage depend heavily on these cadres. The Seychelles National Institute of Health and Social Studies trains nurses at diploma level for their basic qualification and offers limited specialist programs at this level. However, the current health context requires degree-level training. Seychelles will partner with fellow member states in the region to upgrade its nurses and midwives. We have already done so with universities in South Africa. COVID-19 has revealed the resilience and flexibility of nurses and midwives. We maintain high antenatal care coverage, infant and maternal care, and routine immunization were not compromised during the pandemic. Nurses and midwives were redeployed to ensure adequate care for COVID-19 patients and ensuring continuity of care. There is an increasing demand for nurses and midwives due to the expansion of health services, especially in the private sector. Although the international migration of nurses has decreased in the last few years, we still face outflow of skilled nurses to the private health sector and other non-health sectors. Recently, Seychelles has had to resort to overseas recruitment of nurses. In line with the National Health Strategic Plan 2022-2026, which has a strong human resources for health component, we are currently revising the strategic plan for nursing and midwifery to address these challenges. This, together with an increase in investment in nursing and midwifery training, emphasizes the country's commitment to the development of the nursing and midwifery profession. Seychelles welcomes assistance from the regional office and calls on the office to consider the introduction of a regional NERD advisor for leadership and guidance to strengthen nursing and midwifery in the region. Seychelles will support the framework for implementing the regional strategic directions for nursing and midwifery 2021 to 2025 in the WHO-Africa region. I thank you.
Thank you, Seychelles, Central African Republic, to be followed by Congo.
Merci.
Thank you, Honorable Chairperson. Congo, through me, would like to congratulate the regional office for having placed this item on the agenda, because it raises key issues in the quality of healthcare delivery. As in most member countries of WHO, Congo has had a deficit in quality and quantity of human resources in the health sector during the COVID-19 pandemic, particularly for nurses and midwives, where we have a proportion of 13 for 10,000 inhabitants instead of 40 for 10,000 as recommended by the WHO. Efforts are being made by the government, which just received 1,500 doctors trained in Cuba, and it is also envisaging other efforts to train paramedicals. And this is at the forefront of the human resource development plan we are implementing. We agree entirely with the regional framework proposed, particularly the global strategic direction presented to us for consideration by the Secretariat of the Executive Board to train more staff, paying special attention to quality so as to address emergency health needs in the Africa region by 2030. So I support the adoption of the document. Thank you.
Thank you. May I give the floor to Central African Republic? That was Congo speaking, right? Central African Republic, yes.
Merci, Monsieur.
Thank you, Chairperson. The Central African Republic would like to congratulate the Secretariat and more specifically the Regional Director for the quality of this document. Our countries are confronted with shortage of human resources, particularly nurses and midwives. And so this is a major challenge for our countries. But often we do not always give the same importance to the shortage of nurses and midwives, unlike doctors and specialists. So this framework gives us the opportunity to give nurses and midwives their rightful place within the health system. After noting the anarchical establishment of training schools because of the lack of regulation, the CAR came up with a mentoring program to support and accompany new recruits by the seniors. With the policy of community engagement, those who have been trained are now often requested by the communities because they have a lot of barriers when it comes to access to healthcare, particularly for home delivery. The appropriate training programs being implemented are an opportunity for reducing maternal mortality. In order to facilitate the rapid utilization of the nurses and midwives after their training, some partners have made it possible to contract them pending their integration into the civil service. The Central African Republic would like to insist on the first strategic guideline of this framework, which encourages the establishment of training schools in rural areas. There are many advantages to this. There is the fact that the principle of equity is taken on board so that those who wish to be trained for this profession can do it easily, irrespective of where they live. The gap in the number of trained staff, often as a result of the shortage of schools, can therefore be addressed. These actions will help to increase the density of nurses and midwives in the remote areas, which are often at a disadvantage because of migration of the staff who prefer to work in the cities. Local staff now have the opportunity to work in their hometowns with less risk of migration, and this means that we can keep them longer. Consequently, the Central African Republic adopts the framework in its entirety. I thank you.
Thank you, Central African Republic. May I give the floor to South Africa to be followed by Malawi.
Thank you very much, Chairperson. South Africa welcomes the report on the framework for the implementation of the global strategy for nursing and midwifery in the African region under the WHO. It is true that Africa still suffers a lot of skills shortages. As a country, we are fully cognizant of the fact that nursing profession is the cornerstone for a resilient health system from the primary health care level up to the most specialized care, such as in our operating theaters, but also in the intensive care. While more women and children survive today than ever before, vast inequities still exist worldwide, and maternal and child mortality in sub-Saharan Africa still lags behind all other regions of the world. Furthermore, the world is facing a shortage of midwives, with more than half of the shortfall being in our African region, where urgent investment in midwifery education and training is needed. Therefore, achieving universal access to reduce health inequity and to realize improved health outcomes requires competent and motivated nurses and midwives who form the largest group of our health workforce. As a country, we have developed a strategy on nursing and midwifery 2020. The strategy is aimed at institutionalizing integration of nursing education institutions into our, what we call the post-school education system, ensuring the provision of adequate numbers of nurses with skills and knowledge needed to provide optimal care, promotion of a culture of strengthened leadership, management, and clinical governance in nursing, and also to create organizational culture that is conducive to safe patient care. We have prioritized an advanced midwifery program as one of critical skills necessary, given the population's demand for reproductive health care at all levels, from the primary health care challenges relating to teenage pregnancies which have been observed. We have also prioritized midwifery training throughout the health system for the provision of quality care from neonatal nursing services across all levels, from primary right up to tertiary services. We're also working on various mechanisms to strengthen nursing and midwifery, including midwifery and neonatal services, through scholarships for advanced studies, sustainable professional development at the Center of Excellence in Midwifery, and also a dedication to strengthen midwife education and leadership. Honorable Chair, we are also working with other countries within the continent for the harmonization of our training programs to make sure that our training can also be unified across our sub-region and also in the whole continent. As a country, Honorable Chair, as I conclude, we support the adoption of the report and the implementation of the Global Strategic Direction for Nursing and Midwifery 2021-2025 as presented by the WHO Africa region. Thank you very much, Chairperson.
Thank you, South Africa. Malawi to be followed by Kenya.
Thank you, Honorable Chairperson. Malawi supports and adopts the framework for implementing the Global Strategic Directions for Nursing and Midwifery 2021 to 2025 in the WHO African region. Malawi is one of the countries facing a chronic and critical shortage of nurses and midwives in the region. And according to the 2022 National Health Workforce Account Report, the nurse population ratio is estimated to be 4 per 10,000, which is way below the regional estimate of 18 nurses per 10,000. Despite this shortage, the country has made tangible strides over the years in that it is one of the first few countries globally to create a standalone directorate of nursing and midwifery services to optimize leadership of profession at policy level. The directorate developed the first ever nursing and midwifery policy in the region in 2018. Malawi has also a standalone nursing and midwifery regulatory body founded as back as 1966. And currently, the Nurses and Midwives Council is undergoing review to align it with the current developments in the profession. The regulatory body developed scopes of practice for various cadres of nurses and midwives, and it is in the process of developing standards of care and competences for specialized cadres. Just last month, Honorable Chairperson, it pleased our President, Dr. Lazarus Makathe Chakwera, to promote over 20 nurses and midwives to specialist positions in various tertiary facilities in recognition of their levels of training. These specialists are expected to provide critical leadership at the bedside, and this is the first of its kind in our country. Malawi is one of the first countries to have adopted and approved newly developed fellowship programs by the East, Central, and Southern Africa College of Nursing and Midwifery. Malawian nurses and midwives will therefore participate in these regional postgraduate trainings starting from October. The country also boasts of one of the only 6 WHO collaboration centers in Africa. There are plans to create more positions for health workers, including nurses and midwives in the country, through ongoing functional review. And these processes will also see the creation of a district chief nursing and midwifery officer positions to provide leadership at that level, which is a district level. Some councils have already concluded this process of functional review. Malawi supports training, recruitment, and deployment of community health workers to improve access to health care in order to attain universal health coverage. And currently, there are plans to conduct accelerated training of diploma-level community health nurses starting from 2024 in order to produce a substantial number of cadre by the year 2030. These trainings will be conducted in 10 of the 17 nurse midwife training colleges in the country and in line with the population health needs. In conclusion, Malawi has already made remarkable progress in each one of the 4 strategic directions proposed in this framework. Seemingly, we are on the right path. We therefore welcome and support further guidance in the implementation of our health workforce strategy going forward. Malawi endorses the proposal. Thank you, Chair.
Thank you, Malawi. Kenya, to be followed by Gambia.
Thank you, Chairperson. Kenya acknowledges the critical role played by nurses and midwives in the attainment of global health goals of universal health coverage and health security. We commend the work done by the WHO Secretariat in advancing the nursing and midwifery profession and practice, and in developing the framework for implementation of the global strategic directions for nursing and midwifery in the region. Kenya is committed to implementing measures that bolster nursing and midwifery practices and has developed a comprehensive national nursing and midwifery policy, which is aligned with our regional strategy. Kenya has also made significant strides in advancing nursing and midwifery education by developing guidelines on registration, licensure, education for nursing and midwifery, as well as the establishment of comprehensive standards for curriculum development, training programs, and continuous professional development, including scopes of practice to provide for different specializations of nursing and midwifery to encourage career progression and professional development. Kenya prides itself in quality and specialized nursing and midwifery training, and consequently faces significant outbound migration of professionals to developed countries. To mitigate against potential negative effects of this migration, Kenya is in the process of domesticating the WHO Global Code of Practice on the international recruitment of health personnel and is forging bilateral agreements and memoranda of understanding with countries seeking to employ Kenyan professionals abroad. In contribution to the achievement of the objectives of this regional strategy, we would like to go on record, as highlighted in the regional director's report yesterday, that Kenya is one of the countries that has undertaken a health labor workforce analysis, which is used to shape future investment decisions for health workforce, including nurses and midwives in the country. In closing, Kenya endorses the adoption of this regional strategy and requests the WHO's technical and financial support in implementing the priority interventions and actions in the strategy.
Thank you.
Thank you, Kenya. Gambia to be followed by Guinea.
Mr. Chairman, the Gambia aligns with the report on the framework for implementing the Global Strategic Direction for Nursing and Midwifery 2021 to 2025 in the WHO-Africa region, which proposed 4 strategic directions. The Gambia, like its counterparts, is confronted with the pressing challenge of inadequacy, unequal distribution of its health workforce. The recently adopted HRH strategy exposes a glaring disparity. The country's skilled health workforce per 1,000 people stands at a modest 1.33, falling short of the WHO benchmark. Commendable achievements were obtained in recent years. A pivotal milestone was reached through the validation of the costed HRH Strategic Plan 2022 to 2026 and the assessment of staffing norms. The government of the Gambia has been increasing both space and capacity in the schools of nursing and midwifery, accrediting private nurse training schools to open the training space, thereby increasing the production of nurses and midwives without compromising quality. The Gambia has networked and collaborated with several universities in Sweden and the USA to help train several nurse and midwifery leaders so as to give them the requisite leadership knowledge, skills, and competence that will make them effectively contribute to the achievement of the SDGs and the universal health coverage. The Gambia has started specialization training for nurses and midwives in pediatric nursing, anesthesia, perioperative nursing, and the need for specialization for the nurses and midwives cannot be overemphasized. Over the past 2 years, the Gambia has increased the allowances of nurses and midwives to a level never seen before. The nurses and midwives have formed a body called the Quad, comprising of the Directorate of Nursing and Midwifery Services, the National Association of Gambian Nurses and Midwives, the Gambia Nurses and Midwives Council, and the nurse training schools to help them effectively and efficiently strengthen their practice, identify and nurture innovations, and make sure that the quantum of evidence-based research conducted by the hard-working nurses and midwives are made use of to help achieve our national health policy objectives. However, challenges still exist with resource limitations and the challenge of shortage in trainers. Mr. Chairman, the deployment of this new 2022 to 2032 framework and its 4 strategic areas is welcome and will strengthen the ability of the country and many other countries in the region to build the health workforce to ensure that quality healthcare is provided for the people of the continent to provide universal health coverage for all. Mr. Chairman, I would like to conclude by thanking the nurses and midwives for all their hard work, commitment, and sacrifice in their daily work, especially during the COVID-19 pandemic. Thank you for your kind attention.
Thank you, Gambia. Guinea to be followed by Namibia.
Merci, Monsieur.
Thank you, Chairperson. Guinea would like to congratulate the Secretariat for the quality of the document. This framework that defines the strategic directions for nursing and midwifery, particularly in the African region. As you all know, the various epidemics and COVID-19 in particular sorely tested our health systems. And the crucial problem identified remains the availability of quality human resources. To address this situation, in Guinea, we developed a primary health care program based on the use of community relays and community health workers that should have an integrated package comprising 17 preventive, curative, and promotional activities. In spite of the efforts made to train, recruit, and deploy this personnel, we continue to have a lot of challenges, which include insufficient personnel of various categories, particularly all levels of midwives, particularly in the rural areas. In terms of recruitment, the ratio is still very low, and the rural areas are at a disadvantage because it is difficult for us to keep the staff there. In addition, we have a lot of nursing training schools, the quality of which still leaves a lot to be desired. In terms of the prospects for the country, in the year 2024, we are planning to recruit new staff, but this recruitment should take into account the need to decentralize through the local civil service. We will involve the mayors in the recruitment of this staff, and even if the money comes from the state treasuries, it is the local authorities that will manage them. We also plan to develop telemedicine through digital health platforms so as to provide care in the hinterlands. At community level, we will continue to recruit community health workers and community relays and support institutions that provide initial training for health personnel. We hope that these measures will facilitate our march towards universal health coverage. Guinea, therefore, proposed the adoption of the measures and priority measures contained in this framework. Thank you.
Thank you, Guinea. Namibia.
Honorable Chair, Namibia takes the floor to thank the Secretariat for the report and also to support the framework for the implementation of the global strategic directions for nursing and midwifery. Nursing and midwifery services are one of the main pillars of healthcare delivery. In order to improve efficiency in our health workforce, Namibia has developed and implemented the Human Resources for Health strategy to ensure enhanced forecasting, recruitment, and deployment of nurses and midwives in the country. Nursing education is one of the key components of the global strategy for nursing and midwifery. The nursing and midwifery professions are therefore regulated through the regulatory councils in Namibia to safeguard the implementation of competency-based education and accreditation of training and healthcare facilities for practice. The specialization of nurses and midwives in different nursing and midwifery categories has doubled during the 2022-2023 financial year. Furthermore, Namibia prioritizes the capacity building of nurses and midwives through the online courses on leadership skills with support from the International Council of Nurses, Midwives, as well as local institutions. Additionally, quality standards aimed at strengthening the overall health delivery systems in the country and ensuring compliance have been developed. We are aware of the innovation and research in nursing and midwifery professions can contribute to evidence-based improvements in healthcare delivery and patient outcomes. However, research on key areas of nursing and midwifery has been suboptimal in the country. Namibia committed to continue with the implementation of the strategies, ensuring financial support to improve the health workforce as well as capacity building. As I conclude, Chairperson, Namibia supports the adoption of the actions proposed. We thank WHO for the support in the implementation of quality of care standards and request further support in areas of mortality reviews as part of the nursing and midwifery research agenda, as well as the continued implementation of the strategic direction for nursing and midwifery. I so submit. I thank you, Chairperson.
Thank you very much, Namibia. It is now 12:16, and I can assure all of those distinguished delegates, there's about 16 that have raised their nameplates, that they will surely be given a chance to deliver the statements when we open up for this agenda item sometimes during the course of the week. Please note that there will be a number of events taking place today. The first one is the side event, Botswana as a model of excellence on primary health care. It will take place here from 12:45 to 14:15. While during this afternoon session, starting at 14:30, there will be a special event on strengthening multisectoral actions to address nutrition and food insecurity crisis in the Africa region. Before we go on the lunch break, are there any announcements from the Secretariat?
Thank you very much. Lunch break is served for senior delegates in the Grand Palm Hotel at the restaurant, for delegations and other participants in the marquee. Kindly give priority to those who will attend the side event. Thank you very much.
Thank you very much, Secretariat. We may break for lunch.
It's the normal academic work.
It gladdens my heart that Ghana has benefited from this initiative with 109 participants in 4 cohorts. My ministry will continue to work with WHO to consolidate the gains for a truly transformed health sector in Ghana with these groomed leaders.
I'd like to thank the governments in African countries for their collaboration on this program and their determination